Okay, hopefully this will all work out. So welcome to my graduate study workshop. It is useful for graduate study in any discipline, whether you're applying to business school, law school. Obviously the focus, however, is on clinical psychology and related disciplines. So we will go over psychiatry and school psych and social work and counseling and everything else that we can get to, but I think a lot of the advice is pertinent to any discipline. So even if you're not sure you want to go into psych, I suspect some of this information will be helpful to you. Particularly, it's broken into basically three sections. One is sort of explore your options. The other is, how to actually make a choice, and then what to do in terms of how to apply. And that covers what to write and not write in personal statements, how to ask for letters of rec, how to pay for graduate school, etc. So let me start with a pretty important disclaimer, which is I have zero agenda, but I do have opinions. So much of the information that I'll be providing to you, things like, average salary and rates of admission and things, that information is obviously documented and data driven. But some of this is just my opinion, and you should take it with a grain of salt, and you should certainly ask other people's opinions. So that's my disclaimer. Please do not take anything I say as, terribly important. It's just one moderately informed opinion, and you should collect others as you move through this process. But it is not just my opinion that graduate school is important. When surveyed, more than 250,000 first years say that more than 3/4 of them expect to get a degree beyond the bachelor's. And the reality is that the bachelor's, is sort of a necessary but not necessarily sufficient degree in order for most people to pursue the careers they want. And that is especially true in the field of psychology. There is a lot you can do with a bachelor's in psychology, but there's relatively little you can do to access a career that's going to keep you advancing. So yeah, you can become a residential counselor, and you can do that at a group home for the rest of your life, which is great, but you hit a ceiling very fast in our field with a BA in psychology. So there are some cool things you can do, like you could go into human resources and you could get a certificate and you could build your career that way. But within psychology itself, either research or practice, the bachelor's degree is sort of the base degree, and what you really need to enter the field is a master's. So it is sort of the bachelor's has kind of become like our high school degree was, and the master's degree is now sort of what the bachelor's degree used to be. It is the entry level degree for most professions in psychology. So entry level in social work, psychology, and so on is going to be the master's degree. There are some certificate programs that we'll talk about. There's like pupillary counseling, which is only 9 months. There's child life specialist, which is only 10 months. So there are some certificate programs that you can do, or credentialing, like applied behavior analysis. But for most careers in psychology, you're going to need at least a master's. So in terms of thinking about graduate school and kind of sorry, my screen is covered. There we go. And how to approach this, I suggest that you spend some time soul searching. So a lot of the questions were actually about, how do I make this decision? The worst decision of all is no decision at all. That is for sure. But you should, give some thought as to what you value and sort of who you are before jumping in two-footed. So the goal of this presentation is to help you explore the tremendous array of options that a psychology degree opens, as does a sociology degree, as do degrees in other areas. And you can always take a couple of psych courses and become qualified to apply. So no, you don't need to be a psych major to apply for graduate training in psychology. Obviously, it's the preferred degree. But you can certainly go to community college, take a few of the required courses, and still hop in with an English major. So don't feel that the door is shut to you. Likewise, you don't need to be a fourth year to listen to this talk. In fact, if you're a first year, that would be the ideal. If I could get this kind of a talk out to first years, it would be much better, because some of you may be moderately depressed after this, just because once you're in your fourth year, certain things are almost set in stone, like GPAs. Course selections and so on. Fortunately, there is a way out, even if you've had some bumps in the road. So we'll get there. So we're going to start by exploring, then we're going to help you choose, and then talk with you a little bit about exactly what you do once you know what it is you want to do. So explore lots and lots of careers. This is actually just a smattering of them. There are infinite careers in and pertinent to psychology. So not listed here are human resources, marketing. There's all sorts of cool stuff you can do. But there are, certain things you need to consider as you try to figure out what would be a good fit. So think about yourself and what you value. Some of these degrees will require you, likely require you to leave California. Some will not. Some will better prepare you to work with traditionally socially disadvantaged groups. Some will not. Some will, have you being called doctor, and some will not. Some will take you far from your family, which could be a great thing, and some will keep you close to home, which could be a great thing too. So do think about your values. The one thing that you'll hear me say over and over is don't underestimate happiness. So especially in selecting location and your path, happiness is extremely important. It's strongly related to productivity. If you are miserable, it will put a damper on your ability to succeed in whatever career you've chosen. So reflect on who you are, and then use the following information to inform your decisions. So I'm going to go over the basic mental health professions and professionals. For those of you who are taking clinical with me currently, you've received these first couple slides, but there's a little bit more information here. And then we'll go into some of the nitty gritty, but this is just to get everybody on the first page. So, and again, we are focusing on psychology, but we'll touch on other kinds of programs. So to become a psychologist, typically you are looking at a PhD, so a doctor of philosophy, or a PsyD, which is a doctor of psychology. There are dramatic differences between these two degrees, which I will elaborate on in about 2 seconds. But that's sort of the standard clinical psychology route. So you can become a clinical psychologist with either a PhD or a PsyD, but you can also become a counseling psychologist. So most counseling psychology programs are PhDs. There are a few PsyDs. I'll explain the reason for that in a moment. And then the third sort of applied clinical-ish psychologist is the school psychologist. Within clinical psychology, there are 3 main graduate training orientations. The first and most common is the scientist practitioner model. So the focus of these programs is really on science and practice. They want you to be able to conduct original research and to use research knowledge to inform your practice. People getting trained in the Boulder model, called that because there was a conference in Boulder, Colorado, where this scientist practitioner model was put out. People trained in this view are generating new knowledge, and they're generating that knowledge so that they themselves can take it into practice, and that more practice-oriented clinicians can consume that information. And that, in fact, is what led to the other main model, which is the Vail model or the PsyD. This is a practitioner scholar model. So the idea here is that the focus of the PsyD is on clinical practice. Everybody getting the PsyD wants to be a therapist. And they are scholars. They are able to consume knowledge, but they aren't generally creating it. They aren't scientists. So these are the 2 main approaches to graduate training in clinical psychology. Again, scientist practitioner, sort of equal weight on research and practice. The practitioner scholar, much stronger weight on practice. And now, most recently, there's been a 3rd model, and this is the clinical scientist model. And the very top-notch PhD programs are introducing this model, where essentially the emphasis is, 80% research, 20% practice. Boulder 50-50, and practitioner scholar for PsyDs would be more 80-90% practice, 10-20% research. So these are the 3 approaches. Generally speaking, there is a hierarchy in the sense that the highest ranked in terms of publication sites, grant funding, the funding provided to graduate students is highest for the clinical science model. I'm looking at the chat because I see one. Will we be able to access the slides? Yes, I am recording this and that will be made available. Oh, thank you, Alex. Thanks, Alexa. And I will send all of you an email with this PDF. This is also going to end up on the advising site. Good question. Apparently I can just look at the chat when it turns orange, so that'll take Alexa off the hook a little bit. Okay, so hierarchy, clinical scientist model are your most elite PhD programs. I've given you a link to a list of them here, but you know, you have the Harvards and the Berkeleys and the UCLAs and the Minnesotas and the Washingtons on that list. The second kind of ranking would be the scientist practitioner models, but a lot of these are really amazingly good programs. And the third is the practitioner scholar. Practitioner scholar models, PsyD models, tend to have the least amount of funding. Again, they don't emphasize research, so they don't tend to carry grants. They are the least selective of these programs in terms of how many students they take. And we are going to talk at great length about the distinctions between the PsyD and the PhD and how should you decide and so on. Yes, the recording will also be made available. I will send it to you as a link. It will also be on the psychology website eventually. Okay, so these are your doctorates, but there are other degrees that I think you should consider, and I know some of you are. So the medical degree, either an MD or a DO, a doctor of osteopathy, this is what you would need in order to become a psychiatrist. I've given you a link to the American Psychiatric Association here. My only advice about psychiatry, and we'll talk a little bit, I mean, it requires different testing and so on. But one thing to really do in any of these fields, but especially with psychiatry, is try to talk to some professionals who are actively working in the field. There's a huge demand for psychiatry. It's an incredibly valuable profession, but you will not be doing therapy. So psychiatrists primarily are responsible for providing pharmaceutical interventions, medication interventions for mental illness. They simply do not have the time because they're in such high demand to do any therapy. Their sessions tend to be very short and very far between. So, you know, you see a psychiatrist for 20, 30 minutes, they prescribe, they do a check-in in 2 weeks, they do a check-in in 4 weeks, they do a check-in in 6 weeks. And once you're stable, then you get, you know, your 8 to 12 minute medication check-ins every 6 weeks to 3 months, unless there's some disruption and you need to be reevaluated. So it's not what it used to be. Psychiatry, even when I was doing my training, a lot of our psychiatrists did therapy. Nowadays, there's just not enough, there aren't enough psychiatrists to free them up to do therapy, and frankly, they cost too much money for insurance companies to really want to pay them to do therapy. So psychiatry is a really interesting profession, but it is quite different than you may be thinking of it. And so I really recommend pursuing consultation with people in the field. How do you do that? I know it sounds ridiculous, but I get emails all the time. I don't respond to them all, but I do respond to some. And if you go out and you write to 10 psychiatrists in the community and at a couple of hospitals, one will write back, maybe two, and talk to you for 10 minutes. And that's all you really need. Same thing with psychologists, same thing with social workers. Don't be afraid to reach out because most of us have had to do that. And when we have the time and when we can make it available, we will reach back. Could somebody go from being a PhD in clinical to a psychiatrist? You'd have to go to medical school. Nothing would transfer. So no. However, there are several states where clinical psychologists can prescribe medication with a modicum of additional training. There's a huge debate about that. Many of us don't think clinical psychologists should prescribe. Many of us think they should. But the answer is, if you want to be able to prescribe, then yes, there are many states where you would be able to do that. If you wanted to become a psychiatrist per se, you would need to go all the way through medical school and residency. And we'll get to some of those details in a minute. Another degree that not many people think about, but is really incredibly interesting, lucrative, and accessible, is psychiatric nursing. And psychiatric nurses, there's lots of different flavors, and we'll talk about that in a minute. But psychiatric nurses also prescribe with the consultation and supervision of an MD. But often these days, if you go to a community health center for a medication consultation, you might see a nurse practitioner who would do the basic prescription in consultation with a psychiatrist. Again, that's just to make psychiatry services more accessible. We can talk about the MUD-FUD programs, MD PhD programs. There are also JUD-FUD programs, JD PhD programs for those of you who are utter masochists. They're totally interesting programs, but boy, what a lot of work. So we'll get there. Okay. One thing that's a bummer is every time I press chat, my little clicker stops working. This is the thing you want. For anybody thinking about a PsyD, I have one near and dear to my heart, a PsyD or a PhD in counseling or clinical. This is the book of your dreams. Not only does it have several introductory chapters, but it has this awesome listing that you can't read, telling you about every single program in North America. You can get your graduate degree in Canada. It is complete, we have complete reciprocity with Canada. You cannot get your graduate degree in the UK or anywhere else unless you want to redo your residency and redo some of the coursework upon coming back to the US. So Canada and the United States have total reciprocity. Once you leave North America, you need to redo it. You need to redo your internship and much of your practical work. So I don't recommend getting your doctorate if you want to be a practitioner overseas. If you want to be a researcher, then it doesn't matter quite as much. So this is a groovy book. I'm going to show you a couple excerpts to show you what I mean, particularly about PhD and PsyDs. So this is University of Maryland, College Park. It's an excellent, excellent graduate program. I just placed a UCR grad there actually as an assistant professor in developmental. It's a top-notch school. What you'll see in this book is entries that look just like this. And they all begin with this Likert scale that goes from practice-oriented to research-oriented. And generally speaking, your clinical science models, so those really top-tier research-oriented programs, are going to be 7s, maybe 6s. Your bolder models are going to be 4, 5s, or 6s. And your PsyD programs are going to be 1, 2, 3. Some of them will be a 4. But that's a very nice way to very quickly see, like, what's the gist of this program? What's the vibe? UMaryland College Park, very research oriented. It's a 6. So 6 and 7, you'll see some features about these schools. The 6s and 7s, they're going to be very hard to get into. They're going to provide full funding. So let's just take a look at how this goes. Every entry will tell you a little bit about the different theoretical perspectives that faculty ascribe to. Many of these perspectives will seem familiar to people who are taking clinical. They will tell you here about courses that you need in order to get in. These schools are really looking for a BA or a BS in psychology. However, if you didn't do it that way, you can do a post-bac program in psych. You can also just go and get some of the courses, because you can see recommended but not mandatory courses. If you've got stats, abnormal, and a couple lab classes, they'll look at you even if you don't have a psych degree. You would need to have some other things going for you, like research experience and so on. But remember, I'm showing you a top program. Okay, we'll look at this again, and I'll give you a list of courses that are sort of recommended and in what hierarchy and what grad programs on average are wanting you to have, et cetera. The GRE here, the average is a 315. It's pretty high. In general, for clinical PhDs, which is what this is, they're looking for you to be at the 75th percentile or higher. That's about a 315. It changes every year with the GRE, the way it currently runs, but it's going to be it's certainly going to be above a 310. GPA, 3.8. So these are not easy programs to get into. The master's GPA is listed here. It's always a 4.0. It's very hard to get anything other than a 4.0 in master's training, because in graduate school, we don't care so much about grades. So by definition, most people, the vast majority, get 4.0s. So the undergraduate GPA is much more informative, which I know is making some of you anxious because not all of you have the 3.8. In good news, they typically weigh the last 2 years more heavily, and you don't need a 3.8. I'll give you some guidelines of the kinds of GPA cutoffs that are most common for different levels of degree, the master's, the PhD, the PsyD, and so on. And we are going to get to all the master's degrees too. I just wanted to give you a sense of the kind of information you can get from this book, which I don't usually endorse anything, but I really endorse this book. Okay, so here's the admission rate, 3.9%. Clinical PhDs are the most difficult graduate program to get into of anything. Harder than veterinary school, way harder than medical school. So now, not all of them. There are clinical PhDs that will take, 50%, but they're not necessarily accredited. You aren't necessarily going to do terribly well in your career if you go to those schools. And they're going to cost you a lot of money. So here's the perk of going to a good school. Full tuition waiver, so you don't pay any tuition, you don't pay insurance, you don't pay most things, and you get some kind of a stipend or an assistantship or a fellowship. 100% of students going to this school are getting that. They don't pay a dime for their graduate degree. What you will see as the quality of the graduate program decreases is that the students will be expected to pay more and more and more. It's one of the big drawbacks of the PsyD is that it tends to be offered by private schools, sometimes for-profit schools, and it'll run you quite a bit of money to get it, right? Because you got to pay tuition, 20, 30K, plus you got to pay living expenses. It's going to take you 5 years. It's $250,000 to get that, right? So there's huge incentive to get a decent PhD because they're much more likely to fund you. In terms of how many kids come in with a master's versus a BA or BS, it's usually about a third. You'll always see the rate of ethnic minority attendees here. Just be a little bit careful because different universities just define ethnic minority differently. So sometimes international students are being counted here, and they may or may not fit into traditionally marginalized groups. So you do want to watch this a little bit, but just for those of you who may be interested, that is presented in this text. This is another really important thing. All of the clinical degrees will require an internship. So you do what's called practica. As soon as you enter grad school, you start getting clinical experience. You work in different community orgs. You work guidance clinics. A lot of departments of psychology have a clinic on site. You do work in hospital settings. You get lots and lots of different training. But when you're done, after your 4 or 5 years, you then go and do a full year-long, full-time clinical internship. It's called your pre-doctoral clinical internship. And those are accredited. They are monitored and approved by these governing bodies like the American Psychological Association or the Association for Internships. And what you'll see here is that the students coming out of this program, 100% of them are matching to an approved internship, an accredited internship. That's a really important number to watch because I'm now going to show you another program here in California, which is a PsyD. I know the text may be a little small, but again, you'll get these slides. Again, you'll always see that Likert scale at the top. So this is Alliant International in San Francisco. It's actually considered to be a pretty good PsyD program. This used to be called the California School of Professional Psychology. I'm just looking at a chat, apologies. 100% are women. Yes, 100. Okay, so let's go back. Thank you for pointing that out. Yeah, if you identify as male gender, that is a serious selling point. So remember though, this is only 7 incoming students, okay? So 100% are women. Although this is approximate percentage of all students who are women, that may be that their program is 100% female. Psychology as a whole, particularly the applied psychologies, are highly feminized. We have very few men. In my program in graduate school, and keep in mind, I have a joint, I should have said this, but I have a joint degree. So I have a developmental PhD in research, and I have a clinical PhD in practice. It was done at the same time, it just took a year longer. But in our program, we had 1 male across at least 2 years that I can think of. So very few men in this field, and being male, we'll get to diversity considerations, is now considered to be male in a female-dominated field. It's considered a diversity marker, just as being female in a male-dominated field is. But yes, so 100% women, excellent observation. And we will probably see it again up here when we get there. Now I'm looking for it, sorry. Well, this place is 77% women, female identified. Okay, so this is Alliant in San Francisco. You can see on the Likert scale, it's only a 3. It favors practice, much as most of the PsyD programs will be lower than a 4. Courses required, this is important because as you're looking through this text, you'll see the requirements are a little different. If you have a psych major, you don't need to worry. If you don't have a psych major or you didn't do well so one way that you can get out of the psych major is by taking the psychology subject test on the GRE, which we're also going to talk about. And so they're saying, you know, if your GRE psych test wasn't at the 80th percent or higher, and you don't have the psych degree, then we want you to have a grade of C or better in these courses, which I can't exactly show you, but stats, abnormal, experimental, physio, which would be like brain and behavior, and so on. This school does not use the GRE. The GRE is a horrible test, known to be strongly culturally biased. Many of the graduate programs at UCR will not be considering the GRE as of applications for fall 21. So this will be the last year that we were required to use it. A lot of us will no longer be using it. Nevertheless, it is unfortunately still required by most PhD programs and most PsyD programs, probably about half the PsyD programs. But anyway, you won't see a mean here. GPA is substantially lower, right? About a 3.3. And look at this admission rate, 60%. Please mute yourself. Thank you. Nope, I don't know how to mute you all, so hopefully I can figure that out. I'm just looking, when considering grad applications, do grad schools take into account if they worked? Yeah, we'll talk about this. What book is this called? There's a picture of it on the slides, so don't worry, you will get it. Okay, but here's another thing to notice. So they take 60%, which is great for you, except they fund nobody. Okay, so 0% are getting a tuition waiver, 0% are getting any kind of stipend, and certainly 0% are getting the combination of the two, which is standard at the decent PhD programs. Ethnic minority rate higher, and internship placement. So again, remember the accredited internship placements for the PhD at a top school was 100%. Here it's 52%. To attend an internship at a school that's not accredited is a problem. To attend an internship at a site that's not accredited is a problem, because then when you want to go to get your license to practice, you're going to have to prove to the board, which is the licensing board, that you actually have a decent internship. So you really, we'll talk about accreditation, but any grad program, you really want it to be accredited. It's a serious problem to attend schools that are not accredited. It means that nobody's overseeing whether or not the quality of their education is good and whether or not it actually covers the relevant materials you will need in order to successfully sit for and pass a licensing exam. Without a license, you cannot practice in anything because you can't get insurance, because you haven't been brought into the guild, brought into whatever that professional group is, whether it's counseling or it's clinical or it's school or it's social work or it's MFT, marriage and family, etc. Okay, so we're gonna talk about MA programs. I obviously can't resist the chat. Not sure how internships work, that's okay. I know, oh, Alexa's sending you the thing. And how can you know, does tuition cover housing? Are we expected not to work? Yeah, okay. Let's hold all those until we have the break, if we can, but I will answer them all, and I have answers to all of them. I'm really excited to say. Okay, so other mental, so those are, and again, we're gonna come back to this. This is just your little intro. Those are your broad doctoral level programs, as well as your medical degrees, like obviously the doctor or nursing. There are a huge number of master's degrees that you can get in mental health, and it will be the terminal degree. It will be the end degree that many of you will select for a variety of reasons that we will go into. So the most familiar to you probably is the social worker. And when I say social worker, you all think of baby snatchers, but social workers actually are incredibly versatile. It's probably one of the most versatile graduate degrees you can get. You will find social workers everywhere, in hospitals, in prisons, in communities, in private practice, in child welfare, yes. But you find them lots of places you don't expect them based on, you know, TV representations of what social work is. Social work does have more administrative tracks that are focused more on policy, on sort of organizing treatment plans. So, you know, an administrative social worker might be in charge of helping a discharge plan for somebody leaving a rehabilitation center. You know, it might be that person who helps to make sure this person has safe and stable housing, healthcare, and psychotherapy. But there's a whole clinical division of social work and a separate clinical licensure for social work. And those people are in private practice, they're working in hospitals as therapists, they're working right alongside clinical psychologists and counseling psychologists. They can work with severe pathology, they can work with more everyday problems, very, very versatile degree. There's the marriage and family therapist, which is extremely popular here in California and generally along the West Coast. As you move east, it's a little bit less popular. I have no idea why. It's a great degree. Typically, you're going to get a master's degree in marriage and family therapy or a master's degree in counseling and sit for marriage and family therapy or specialize in it. The issue with marriage and family therapy is that it is, as it sounds, marriage and family. So although an MFT can do individual work, it's unlikely they'll be asked to. It's unlikely that somebody's going to call them up to do it because their title and their expertise is in couples and family work. But again, if you know that's what you want to do, it's a perfectly fine option. We'll talk about salaries, we'll talk about prestige, we'll talk about all of that. There are differences across these different master's level degrees that I'll go over. There is the professional clinical counselor, and I've listed it as PCC here. Later in the talk, it's listed as LPC, licensed professional counselor. There's also licensed mental health counselor. These are all sort of different flavors of the same thing. This is a master's in counseling. These are individuals who do individual therapy, just like the MFTs, just like the clinical social workers. They are trained in schools of counseling. It's a 2-year degree, just like all the other ones are. And again, we'll go over what the distinctions are. Now, school psychologists in the state of California can also be master's level. Obviously, it's a different kind of degree then, right? It's a different kind of job. A PhD level school psychologist is going to usually oversee an entire district, and they'll be sort of the very top of the pecking order. But within schools, there's lots of school counselors who are master's level school or educational psychologists, and they can do various educational assessments, assessments for learning difficulties, and so on. Then you have master's training in psychology. So this varies a little bit, but there's master's training in experimental psychology, there's master's training in developmental and cognitive, but usually it's going to be a master's degree in sort of general psychology. Usually that's more of a research-oriented MA. Typically people are doing that because they're trying to prepare for a PhD application, whether it's a clinical PhD or it's a PhD in some other branch of psychology like developmental, cognitive, social personality, behavioral neuroscience, etc. So these are all master's degrees. There are more of them. I'm just giving you sort of an array. And then there's a bazillion other careers that typically have certificates associated with them. So these are drug and alcohol counselors, child life specialists. These are people who work typically in a hospital setting to help facilitate children navigating medical procedures, for example. They work on oncology wards and so on. Behavior analysts, these are people who typically work with folks who have intellectual disabilities or autism spectrum disorder. Speech pathology, occupational therapy, there's research coordinators or lab managers, et cetera, et cetera, et cetera. Lots of different careers. I have 7 comments, so I'm just gonna make sure nothing's on fire. Yes, I will tell you all of these answers. What she said. Regarding the GRE, the sound glitched. Oh, sorry about that. We'll be coming back to the GRE a whole bunch. Oh, look, and what a perfect pause. Are you kidding me? Couldn't have predicted that better. Okay, so let me just take a look at these questions. So yes, slides and recording will be made available. I'll send you all a link and I'll send you a copy of the slides. MD, PhD, and JD, PhD programs. So yeah, so anytime you go to medical school, you'll have the option to also get a PhD while you're in med school. It is a little bit quicker. So usually to get the PhD, it'll add 3 years, maybe 4 years. It's not going to add the full 5. It does train you at a deeper level in research. There are MD, PhDs, not only in psychology, but you can get your PhD in biochemistry. You can get your PhD in all different kinds of areas and combine it with a medical degree. It's just, you know, a lot of work. So we're going to talk about GPA a lot. There's a question about, you know, when you're looking at, when grad schools are looking at the GPA, do they take into account kind of who you are and the hardships you may have faced? Maybe you've had to work to support yourself or your family. Maybe you're a single parent. The answer is yes and no. We'll get there when we talk a little bit about diversity considerations. Accreditation status will be listed always on the program's website. So that's how you will know. There are also, like, the American Psychological Association will have a list of all the accredited programs. I have a bunch of websites that will be built into this presentation, and there'll be clickable links in the PDF. Likewise, I can show them to you when we take another break. So yeah, you don't have to look them up individually, fortunately. Tuition doesn't cover housing. So yeah, so the way this works with a PhD is you get a stipend. So at UCR, our graduate students, keep in mind UCR does not have a clinical or a counseling psychology program. Our Graduate School of Education does have a school psych program, but we do not offer any clinical or counseling work, training. But even at UCR, where we have non-clinical PhDs, the average stipend for our grad students is about $22,000. Plus, they don't pay tuition, they don't pay health insurance. So they have to live on $22,000. They receive that money in exchange for doing research or teaching. That is a 9-month salary. They usually get an extra $4,000, $3,000 to $5,000 in the summer. So that's to give you a feel for what, you know, a graduate student here is living on. They're living on, you know, $26,000, $27,000 a year. They're not living well, but they're also, you know, by and large managing. Stipends can go much lower in more rural areas where the cost of living is lower. And they can be much higher, especially if you obtain outside funding. We're going to talk about how to do that as well. So, for example, the going rate for the National Science Foundation Fellowship for grad school is like $32K a year. Also, some schools have graduate housing. We have it here at UCR, which is at a reduced fee. UCI has it. Many, many schools will have that. Okay, so are there programs that combine the master's and PsyD together? Okay, so, sorry, I'm gonna make this bigger for myself. Oh, that's so much nicer. Can I make it not quite so big? There we go. Sorry, folks, you're adjusting to the fact that I don't usually teach synchronously. Okay, so are there programs? So PhDs and PsyDs, the PhD, you typically will earn a master's on your way to getting the PhD. So you'll do 2 years for the master's and then the remaining years to get the PhD. You can walk for your master's, you can take the certificate, but nobody cares about it because the PhD trumps it anyway, so nobody cares. Like, I would never list I'm an MA PhD, because once you're a PhD, it trumps everything else. Same thing with PsyD. So there's no MA PsyD combo because you would never need it. The higher degree is the one that matters. Internship, we're gonna come back to. Sorry, I'm trying. Highest recommended degree for counseling psychologist or a therapist. It really will depend. We'll get to this in a moment. I think for a lot of people who want to be a therapist, the highest degree you need really is the master's degree, particularly a master's in social work, maybe a master's in counseling, but you can go on and get a PhD or a PsyD either in counseling or in clinical if you want to. And we can talk about that. Do you need a master's to progress to a PsyD? Not necessarily, but you will find that maybe a third of the people who go into the PsyD already have a master's. And we'll talk about, do you need a master's or not before you apply? Most of that's going to depend on what your experience is and frankly what your GPA is. GPA is really important. Also, Satish, because I know you so well, there are no dumb questions. The only dumb questions are the ones not asked. Can you talk more about BCBA? Board Certified Behavior Analyst. Yeah, I mean, a board certified behavior analyst, it's typically a 1 to 2 year degree. You're going to do applied behavior analysis with individuals who have intellectual disabilities or autism spectrum disorder, typically, sometimes other kinds of brain injury or other kinds of neurodevelopmental disorders. Applied behavior analysis is sort of a reinforcement-based, very planful intervention for individuals who are thought to not benefit as much from kind of talk therapy or what we would call insight-oriented therapy. And so it's things like, you know, working on eye contact, and every time the person looks at you, they get a reward, whether it's a sticker or it's a high five or it's a high-pitched praise or it's a piece of food. It will depend on that child or adult that you're working with. You know, ABA is really exciting and interesting for newly minted BAs and BSs because it's a job you can get. We're going to talk about how to get clinical experience, and you can become an ABA therapist, applied behavior analysis therapist, assisting individuals with these kinds of neurodevelopmental disorders. And it's really exciting for a year or two, but very quickly you sort of hit a level, right? Like it becomes a little bit less exciting because there's not talk therapy here. It's you're training people to perform certain kinds of behaviors, whether it's eye contact or it's vocalization or it's sitting still in a chair. And so I think people get tired of it pretty quickly. We'll talk about whether being an ABA therapist is a good experience for school. So the issue with the BCBA is that typically they would be the person in charge of all those other kind of ABA therapists. They would be the person who designs the intervention plan. So it's a little bit more exciting, but again, it's a fairly modest level degree. It's great if that's what you want, but it's not, you're not going to be able to grow a terribly huge amount in a field like that. Is there an MA MD combo? Absolutely. A lot of medical doctors also get a master's in public health. That's a pretty common one, or public policy. So there are also MA PhD, MA MD combos. There are also MA PhD combos. So you could get a PhD in clinical with a master's in public health or master's in epidemiology. There's infinitesimal options here. Okay, gap year we're going to talk about in a minute, and masters and PsyD, we'll talk about that. We're going to talk a lot about masters. ABA is a good experience for, I'm going to close the chat now. Any other questions before it looks like they're mostly posted, so that's good. We have a whole nother question thing in a minute. Is ABA therapy good experience after school? Yes, it pays, which is great. Paying rent is a good thing. That's a very difficult question to answer unless I know what your particular goal is. It is better experience if you're heading for an applied degree, like as a therapeutically oriented clinician, as opposed to a research oriented degree. It is, I would say, very common. It's probably the most common thing that students do after getting their psychology degree because it's so accessible. So you're going to be one of many applying with that experience. And as you'll see in a moment, the PhDs in clinical psych don't necessarily value prior clinical experience very much. Like they want you to have a little, but that's it. What they really want is research experience. The PsyDs may look on it more favorably because it's applied. But again, it's a very different kind of work than what you would typically learn in graduate school. There's not a lot of ABA in graduate school. Okay, so Alexa, just be careful not to totally contradict what I say. So did Jeremy ask about, oh, gap year. No, wait, Alexa, I totally agree with you, but try not to answer the questions till I do, just in case we disagree. I thought you were saying yes to the behavior analysis. In terms of experience, if you want to pursue the MFT route, we will get there. So there's a whole section about kind of how to apply and how do you get the extras and what extras do you need. Alexa's head of Psych-Hi, so she knows lots about all this. We will get there. ABA and occupational therapy are different, although they often work with the same population. It's a great degree. Sorry, just looking. Would it be helpful in applying to graduate school? Any research experience is extremely helpful in applying to grad school, obviously, especially if you're getting a PhD. Okay, we'll come back to all of this momentarily. The only thing I'm noticing is it's hot as hell in here, so hang on just a second while I turn on some AC. Oh, the joys of teaching at home. Okay. Air conditioning. Okay, so these are the career options that you may find of greatest interest to you, although I'm going to give you a couple others. We're going to talk about education. We're going to talk about OT. But that's just what most students are asking about are social work, marriage and family therapy, counseling, clinical, psychiatry, nursing, etc. So you need to make a choice. And I guess the only thing I can tell you about choices is they're incredibly anxiety inducing because once you make one choice, you feel like the door is closed on all the other choices. But it's not, as we just talked about with master's programs, it is very common, a quarter to a third at UCR in our program, as many as half of our incoming students have master's degrees. So you can go and get a master's, you can decide, I've kind of hit this level, I want to go back to school. I have a student in my lab now who has a master's in social work from actually UMaryland, and worked for 5 years, and then decided that she wanted to go and get her PhD. Came to me to do her PhD. So you're not locked in. Likewise, within social work, there is a PhD option. Within MFT, there is a PhD option. So you can get your master's, work for a few years, decide you're kind of hit a ceiling and you want more, and go back and get the doctoral degree. Those transitions are a little bit different than getting a master's and then going for a PhD in psychology, and I'll explain how right now, apparently. The difference is that because those programs are used to having people go from the master's into their PhD, and in fact, to some extent prefer it, you'll do your master's in social work, you'll go practice for a bit, you'll come back, and you'll do maybe 3 years to get your PhD. They'll count your master's towards it. For us, if you come in with a master's degree, you have to do all 5 years of your PhD anyways. Same thing with the clinical PhDs. They don't count MA level training towards the PhD because it's so different. Even if you're getting a master's in clinical psychology at Pepperdine, which I know a lot of you think about, if you then go into a clinical PhD program, you're not going to get any credit for that master's degree in all likelihood. You might, at UCR, for example, we'll give you 1 course per year of post-bac education. So you'll get 2 courses, but they can't be core courses, so they can only kind of cover your electives, which you're going to take anyways. So when you're earning your MA and then your ultimate goal is to get the PhD, in most cases, you're going to end up still doing 5 years for that PhD, the exception being social work, and many of the counseling programs also have it sort of built in. In fact, some of the counseling programs won't take you into their PhD until you've done their MA, and then they invite you to apply to their PhD. So Boston College works that way, for example. Yep, and I have a whole awesome thing for helping to find jobs clinically and research-wise. Why will this not close? Here we go. Research-wise post-bac. PsyDs are the same way. They aren't going to give you credit for your MA. So you're looking at 4 or 5 years with the PsyD. You're looking at 5 or 6 years with a PhD. And we will come back to all of this momentarily. Okay, so how do you make a choice? You do have to give a lot of thought to you. There are different features of these degrees. The PhD, for example, typically requires a tremendous amount of self-discipline. You have to really be able to sit down and ask yourself to write, ask yourself to conduct research. It's a little different with the PsyD, where most of your time is spent doing clinical work. You've got clients and they're booked. You have to show up. But it's different when you're working at home, as you all are now. You know how this is going, right? So some people are very good at that and some people struggle more. But overall, what do you want to do? Best decision is, do you want to do more research? Do you want to teach? Or do you want to work one-on-one or in small groups with actual clients? So that's a really important distinction. If you want to be a professor or you want to be a research scientist, then you absolutely need the PhD. You might be able to get a PhD in social work, or usually those PhDs are called PhDs in social welfare, or a PhD in counseling, but you need a PhD. If you want to be a practitioner, then the PsyD is probably a great option for you if you've got money. And if you don't have a lot of money, then any of the master's degrees would be great options. Probably the social work degree would be the best because it's the most versatile. You can work with clients of all different severities. You can work with clients in all different settings. And social workers do make on average about $7K more than, for example, a marriage and family therapist each year. And I'll show you those data in a second. Do think about what you're good at. I've had students who come in saying, you know, they want to be clinicians and they just are not likely to be very good at it. They're, you know, they have vulnerabilities that they don't want to work on. So if you're incredibly anxious and shy, you can be an excellent clinician, but you've got to be willing to do your own work. You know, some people think they want to do it, but I hear this a lot. Students realize that they're very sensitive, so they take on the difficulties of others and they're very likely to burn out very quickly. Again, many of the things that you are struggling with can be remedied if you're willing to put the work in. But then you've got to be willing to put the work in to be ready to really do clinical work. I have students, I've taken students into the PhD program here at UCR, and by the time we get into year 2 and we're working on their first big project, it's very clear that they're just not well suited to research. They don't love it. They aren't hugely detail oriented. They don't enjoy academic writing, which is very formulaic. So you need to think about what you're good at. And the beauty of this is if you make a mistake, life is really long. Like, I think the hardest thing about this is people invest, like, put so much weight in it. Obviously nobody wants to make a mistake, but it happens all the time and you'll be okay. So I've had, I don't know, maybe 3 or 4 students who have come in for the PhD in developmental with me. And I've really encouraged them after year 2, this doesn't seem like a good fit. One became a library scientist, one became a social worker. One is now getting her PhD in a totally different field at a different university. Some just leave with the master's and teach kind of, there are teaching jobs you can do with a master's. It's called adjuncting, but basically as sort of a visiting teacher at different schools. Some have gone on to high school teaching, which by the way was my backup plan. I think high school education is really awesome. So what are you good at? Where do you want to work? And we'll talk about this in greater depth. Who do you want to work with? How much time do you have? These degrees range from 9 months to 8 years. So how much time do you have? And how much money do you have? So again, remember, a big defining feature of the PsyD is, you know, it's going to cost you a lot of money. Master's degrees also can cost money. There are ways to get them funded, particularly in social work. And I'll share what those ways are again in a little bit. So what do you want to do? Psychologists do a ton of different things. It's really, I think it's, well, of course, I think it's the best undergraduate degree. But it's one of the best in terms of just being a huge, throwing the doors open to opportunities moving forward. So assessment and testing, personality testing, intelligence testing, achievement testing, these kinds of services are provided primarily by psychologists and either clinical or counseling psychologists, mostly clinical psychologists who have either a PsyD or a PhD. And they are very lucrative. They will make you a good amount of money. In California, there are these educational psychologists, which are MA level, master's level, and they do basic educational testing, so achievement and IQ or intelligence. But to be able to do the broad battery of tests that are available to psychologists, you do need a PhD or a PsyD. And it is the thing, just like medication sets psychiatry apart. Testing sets psychology apart. It is the thing that we do that other people don't do. So if you're really excited to test, or you want to test for, you know, competency to stand trial, or test for any other types of things, then you need to get a PhD or a PsyD. If you want to be a therapist, any of these degrees is fair game. If you want to teach, you know, if you want to be a professor, that's typically a PhD. If you want to teach, you know, with an MSW, you can teach. With an MA, you can teach, but it's going to be a different kind of teaching. You're not going to be a professor. You're going to be teaching, you know, a single class at a community college. It used to be that MA level folks could get a job as a professor at a community college, not anymore. PhDs are taking those jobs because there's a lot of PhDs looking for work. So if you want to be a professor, you know, where that is your job and you have job stability and you have all the benefits that go with being a professor, of which there are many, like job security and very good retirement typically, then you need the PhD. But if you just want to teach as part of your gig, then a PsyD, an MSW, any variety of degrees will be fine, because you can always go to your local colleges and say, hey, can I, you know, sign up to be a lecturer, or can I sign up to teach a class, you know, a summer class here or there. So it just depends kind of what sort of teaching you want to do. A lot of high school teachers at private schools have PhDs and certainly have MAs, not necessarily in education. So, you know, my chemistry teacher had a PhD in chemistry. She chose to teach high school with it as opposed to university, but teaching is available. Research, if you want to be a researcher and you're creating the knowledge, that's going to be a PhD. But there are ways to do research as a master's level clinician, in that a lot of us develop interventions, right? And the people who then roll out those interventions are clinicians working in the communities. And so they will be part of the program evaluation on the ground. So it's just a different kind of research, but you can certainly get your feet wet in research. If you're doing your MSW, for example, there will be people doing social welfare research on foster care, for example, or family violence, or social work tends to focus more on social justice issues, juvenile justice involved youth, and so on. And you can do that a little bit while you're getting your degree. And that would actually be great preparation in case you want to go on and get a PhD in social welfare or in anything else. When I was doing my degree, I had a colleague, another student in my cohort, who had an MSW and was now getting her clinical PhD. So that's not terribly unusual. It's a little dicey because you need to really communicate that your interests have switched from practice towards research. But as long as you're able to demonstrate that, you're highly marketable to come into a PhD. Supervision means that you are overseeing younger clinicians, younger meaning in their training, not necessarily chronologically. So clinical supervision you can do once you have your own license, and that's a common way that people sort of spice up and diversify their day-to-day routine. You can consult companies. There's a whole division of psychology, industrial organizational, which is all about the interface between business and psychology. So lots of consultation there, but social workers consult to companies, psychologists consult to companies. You can do administrative work, policy work, and then of course prescribing, which is typically the MDs or nurse practitioners, psychiatric nurse practitioners. Let me just take a quick look at comments to see if there's any fires, so to speak. Psychi is really good. What if you want to do research to then use in clinical practice? Yes, so we'll talk about that. Whoa, MSW for adjunct in therapy. Community colleges could do the same with the MFT. What is your opinion on online? We're going to talk about online. Yes, so MFTs would adjunct typically at an MFT program. MSWs would adjunct in an MSW graduate program. So yes, you can do that with any of the degrees, but remember these are guilds. So social workers can only be supervised by other social workers and taught by social workers, right? Likewise with MFT, likewise with counseling. So once you pick your track, you're going to be doing your teaching, your supervision, your service in that track. There is some movement and different sort of professional organizations have different strictness, but social work is a particularly strict one. So they by law have to be supervised only by social workers, whereas when I was doing my work, I was supervised by psychiatrists and I was supervised by psychologists. But I could not be supervised by a social worker because I have to be supervised by something at or above me in terms of degree training. Okay, so let's keep going. So what do you want to do? Where do you want to work? This is also very relevant. You know, I think a lot of people think private practice or small group practice, right? Like when you think therapist, you think I'm going to work in a little office, like a little suite with 2 or 3 other people, or I'm going to work in my home and I'm going to see clients, you know, however many a day, and I'm going to do that every day. The reality is you're probably not going to do that because you would probably burn out. It's quite emotionally taxing, not because of the content of what's being shared, but just paying 100% attention to another person hour after hour after hour is quite exhausting. So typically you will do private practice, but you'll mix it up. You'll have supervision in there. You might do some consultation to an area school on some of their more behaviorally challenging kids, or to a local shelter, but you're going to try and mix it up a bit so that you're not just day in and day out doing therapy. It will get to be too much, too tedious, etc. So most of us are doing lots of different things. It is very common for clinical PhDs to work as professors, and that's their primary gig. They teach, they do research, but 1 night a week, 4 hours a night, they run 4 therapy clients and they keep a little private practice going on the side. A lot of my colleagues at other schools do that. A lot of the people I trained with did that. So it's not at all unheard of to do that. People on the chat to some degree are asking about, what about combining research and clinical? You can always take a research job and then decide not for you and go take a clinical job. But it would be much more difficult to do the reverse. So once you've got your degree, if you think you want to be in the academy, which means being a professor or running a big research program, you would do that first. And then if you didn't like it or you wanted to change, you'd go into practice. But once you hit practice, it's very hard to jump back into the academy because you will have fallen behind on the different statistical methodologies, on funding, on all sorts of things, publishing primarily. Okay, so private or group practice, that's the most common place that people envision themselves working. But you can also work at colleges or universities as a mental health professional. We have case managers at UCR. They are social workers typically, or counseling masters. We have lots of therapists over in CAPS. They are MFTs, they are counselors. Some of them are social workers. They typically do have a psychologist there. We have 2 psychiatrists who work over in our health services at UCR. So counselors often are doing clinical work on college campuses, because one of the big differences between clinical and counseling is counseling tends to emphasize sort of more normative life stressors, big role changes, loss of a parent, divorce, kids moving out of the home, you know, big challenges, but not beyond the norm. Whereas clinical psych historically has been focused more on both those kinds of stressors, but also more severe and persistent challenges like psychosis or some of the more severe chronic disorders. So that difference is changing a little bit, but it's still the case that counselors are trained more in like vocational advising, and clinicians trained more in sort of formal diagnostics. So you do see a lot of counselors over in colleges and universities because they're helping students figure out what career is right for them, or helping students navigate, you know, fairly normative life stressors, because most college students are pretty high functioning. Although many are very high functioning despite carrying significant diagnoses. So also at colleges and universities, of course, you're going to find your professors and your researchers. So there are PhDs in clinical who work in medical schools as researchers, so they don't really teach, or they work in departments of psychology, and then they'll teach and do research there. All of us work in hospitals. You're not very likely to find counselors in hospitals for the very reason I just mentioned, which is counseling psychology historically is more focused on people who are dealing with more normative life stressors. And in a hospital setting, typically you're going to find people who are dealing with extreme mental or physical health problems. There's a whole division of clinical psychology, health psychology, and pediatric psychology, which is the child version of health psychology. That is hospital-based work. It's the interface of physical medicine and mental health. There are medical social workers. There are psychiatric social workers. You will find MFTs in hospitals sometimes, but less commonly. Again, in hospitals, you're going to find social workers, PhDs, and PsyDs. Positions in medical schools, obviously you'll find lots of MDs there, but you will find PhDs there as well, doing research. Outpatient clinics, guidance centers, business and industry, military, prisons, courts, schools. We are everywhere. Some degrees give you greater access to some locations than others. So that's why having a sense of where you want to work is helpful. The kind of work is also very different. Hospital work, short-term, acute, high crisis typically. Community work, longer term, less crisis, right? So you'll have to get a sense of what you prefer. And you can do both. You can work in the community 3 days a week, and you can work in a hospital 2 days a week. No problem. You can create the career you want. Some are more cookie cutter and they'll be laid at your feet, and some you might have to get more creative with, but whatever you want or need, you can do with one or more of these degrees. Okay, and then the last big thing, of course, is who do you want to work with? Kids, elderly, it's a very lucrative field that is rapidly growing. Prisoners, families, couples, individuals, the medically ill, the mentally ill, the poor, the wealthy, fairly high functioning, meaning insight-oriented, verbal, fairly low functioning, maybe they're struggling with sort of basic life tasks, basic, what we call activities of daily living, hygiene, work, housing. You need to think about who you want to work most with. Certain groups require specialized training. So if you want to work with kids, you need to be trained to work with kids. And both clinical programs, PsyDs, and social work programs will have child-adolescent tracks often, or child and family tracks. And if you know you want to work with kids or families, then you need to be trained in that track. Once you're trained with kids, you can work with adults. But if you're only trained with adults, it's very hard to get a gig working with kids, because as part of your kid work, you'll be trained to work with adults because many kids have parents. And if they don't have traditional parents, they have foster parents or social workers who function as parents. So there are certain areas where you'll need to do specialized training. But in general, you know, having a clue as to who you want to work with will help you focus in on your interests most effectively. So I mentioned that social work has specialty areas. I should have also mentioned that this book, this handy book, of which I have a whole slide about early and I have another one later. If you are interested in particular topics, in the back, there's an index. So let's say you're interested in rural mental health. There's a whole list of all the schools on here that focus on that. Or you're interested in psychoanalytic work, or you're interested in pain management, or you're interested in oncology and cancer care. All of this is in here. So, you know, pick a topic and you just say, okay, well, I'm interested in homelessness. And you go to H and you look it up and there it is. And there's, you know, whatever it is, a dozen schools with, and what this means is they have faculty there who are experts in this topic. Likewise, they have it forensics, immigration, refugee populations, etc. So the book is actually quite handy. Unfortunately, there's not an equivalent book for social work. There is one that's sort of like this for counseling. This is actually the book that you would mostly use for counseling, but there's another book that I have at the end. I'll give you a bunch of resources. But anyway, so knowing who you want to work with will help us decide what would make the most sense for you. Think about time and money. Okay, so time, MDs and PhDs are going to be 6 to 7 years. So the PhD, the PhD typically works kind of like this. You go to school. If you are in most programs, you'll start doing some clinical work, practica work your first year, and you'll do coursework. You'll do coursework for your first 2 years. You'll do practical work. You'll start moving through the hurdles of doing more independent writing, more independent research, and you'll move through, and usually in your 5th year, you'll write a big research paper called the dissertation. You'll defend that, and then you'll go on and do 1 year of internship that I mentioned. And then you'll either go take a job in the academy, or maybe you'll keep doing some clinical work until you're eligible for a license. MD is a little bit different. You do 4 years of medical school. It's pretty structured learning, and then you go and do your residency, which will be 3 or 4 years. So somebody had asked about internship. PsyD, same kind of thing. You're going to start practicing right away because they're so focused on it. It's a little bit faster, so you could get out of there in 4 years and do your internship the 5th year. PhDs, it's very unusual to get out in 4 years. You're going to do it 5 years, and then you're going to go do your internship. The way the internships work, it's just like the med school residency. You apply, there's a common application, and then on match day, which is whatever date it is, it's 1 day for med students, it's another day for the PhDs and PsyDs. On match day, you get an email that says, hey, you've matched. And then you get to breathe a sigh of relief. It means that you picked a place and they picked you too. And then a little bit later, you learn what place picked you. And then you go do your degree. Now, once your internship, now once you've finished your internship, or once you've finished your residency in the MD world, you have your degree, you have your PhD, your PsyD, whatever, but you still need to be licensed. And to get licensed for clinical psychology and counseling psychology and school psychology, you need to get what's called SPE, Supervised Professional Experience. So once you've got your degree, you don't have a license yet, you haven't taken this big national test as well as a state test on ethics to be certified to do independent work. You need to get that, and in order to get that, you have to work in collaboration with and under the supervision of somebody who has the license for usually 2 years. And then you sit for the test. It's called the EPPP in psychology. And once you pass that licensing test, then you're a licensed psychologist and you can go out and practice, or you pass your medical boards and you're a licensed psychiatrist. Same thing with the MA to some extent. So when I say 5 years, or I say 6 or 7 years, or I say 2 years, yes, your formal schooling is 2 years for the MA. But just like with the other degrees, you need SPE, Supervised Professional Experience. So let's say you're doing an MSW or an MFT, you go do your 2 years of school, coursework and practica. So half your time spent doing coursework, half your time is going to be spent working at some kind of a clinic. And then once you've got your degree, you're going to go get a job at a counseling center or somewhere like that. Maybe you'll work for child protection, whatever, under the supervision of somebody who has a license. Once you have enough hours, it's a finite, you know, it's a number of hours. It varies field to field. Once you have those hours, then you apply to be able to sit for the test. And just like in psychology, there's a social work test, there's an MFT test, there's a professional counselor test. And you take that test and then you are licensed. Then over the course of your career, you need to maintain your license. So we have to continue to get education. It's called CEUs, continuing education units, but you get those by going to conferences or attending trainings and so on. So time is longer even than what I've listed here. 2 years for the MA, 5 for the PsyD, 6, 7, 8 for the PhD or the MD. Money. Your PhD is most likely to be funded. Your MDs and PsyDs are the most expensive by far, and the MAs kind of vary, and we'll talk about that a little bit. Then there's this slide, which I know you're all waiting for, which is how much time and money do you want? So some of these jobs are more flexible, some of them less so. Some of them pay absurd amounts of money. Some of them pay plenty to have a decent quality of life. But here's where you'll start to see some of the differences, and we'll go into this a little bit more. These are based on Los Angeles 2020 Glassdoor advertisements. So, you know, if you go to North Dakota, these numbers are going to dip. If you go to New York, these numbers are going to go up. They are just ballpark, but probably the relative levels in terms of who makes more versus who makes less, those will stay the same. So you can see, you know, your average clinical psychologist makes about 110K. That's a good living. It's not a psychiatrist making $250,000 a year, obviously. Occupational therapy and nursing and school psych, you know, around 100. Nursing's weird. It ranges from 38 all the way up to like 132. It depends on what kind of nursing degrees you get. Counseling psychologists make a little bit less than clinical. And then of course the master's level clinicians, your social workers, your licensed professional counselors, your marriage and family therapists make less obviously than the PhDs or PsyDs. And you can see what I was saying about sort of the payment scale. Social workers typically make more than the other MA degrees. Licensed professional counselors make the next amount. Marriage and family therapists tend to make the least. Drug and alcohol counselor is it typically is a certificate program. It'll usually run you somewhere between 10 and 14 months. So they don't make a ton of money. It's not going to cost you a lot to get it. But this is just some, or these are just some examples. Clearly lots of questions have come up about this. So let me just take a peek at questions. Okay, online we're going to get to MSW and adjunct. Yes, you can do the same with an MFT. How does post-bac work at UCR if I'm a graduating senior? We'll talk about that a little bit. You can, okay, sorry. So if you want to speak with me privately, just because that's coming up, if you want to speak with me privately, just email me after this and we'll find a time. I do ask that you process the information for like a day would be ideal, because some of you will be freaking out after this and that just makes me stressed. But take a minute to metabolize all this. Wait until you get the slides so that you can look through the information again. The one thing is there's, you know, 170 of you on here right now. So you can imagine that as the only clinician in the department, I get a lot of questions and I'm totally happy to answer them. But as much as possible, if you can make sure they're questions that I haven't already answered, I'd be really grateful. So yes, we can definitely talk in private. UCR's COG and behavior grad programs, psychedelics as a form of intervention. We'll talk about that. Do you need to be a psychiatrist or a clinician to work in the prisons? Absolutely not. You typically wouldn't be a counselor. You might be a counselor because they have like a whole career counseling division, but social workers are probably the most common thing you'll see in the prison. You'll see tons of psychologists because they do a lot of the testing. But you do not need to be a psychiatrist. You do not need to be a PhD. The prisons have space. They have psychiatric nurses. They have need and space for everybody. Is it a lot of training to work with multiple, like if you wanted to do children, family, and individuals? Well, I'm trained to do children, family, and individuals. So no, it's you know, you would want to get specialized in child. You would want to do a track that trained you in child. So I should have explained my background. I usually do. now seems as good a time as any. I went to, oh gosh, I never know really where to begin. What I would say is that the only reason I made it where I made it is because I followed the advice of a lot of teachers and mentors who led me, because I didn't have a terribly great structure in terms of family of origin to get me where I wanted to go. And I didn't come out thinking I could go very many places as a result. So I didn't plan to graduate high school, and then I did. I didn't plan to go to college, and then I did. I dropped out of college. I went back. I tried to drop out of grad school. So, I mean, I guess that's good because, like I said, you can really stumble and still make it if you pay attention to the people around you that are trying to help you, because there are people. Some of us have them more accessible than others. But if you look, there's people in your corner. You just might need to brush away some of the cobwebs. So I ended up going to the University of Minnesota for my graduate training. It's one of the 5 programs that has a joint doctoral in developmental and clinical psychology. Berkeley has a child track that's similar. University of Washington has a child track that's similar, but these are very competitive schools. So all of them have acceptance rates, under 5%. So anyway, I was very fortunate to do well in college, although I didn't do very well in high school. And so I finally finished college. I took 2 years off. We'll talk about gap years. And then I went and did my degree. I then went to Boston, which is where I'm from. And I did a year at Cambridge Hospital of Harvard Medical School for my internship. And I found that to be kind of a complicated experience, and I decided I didn't want to do clinical work full time, although I had gone into it thinking I might. And I ended up then working for a year after that as a clinician for Wellesley College to get my hours that I need to be eligible for licensure. Although I do not have a license in California, I never took the test because by then I was a professor. At any rate, I then ended up a professor. So we can talk more about that when we get to questions and answers if it's interesting. But what's interesting about it, and to answer the question, is that I'm trained in child. And as part of that, I worked with children and families. But of course, you definitely get adult training no matter where you are and what you do. So to the question of can you do it all? Yes. You'll like some of it more than others. And so I spent most of my time working for about a decade in Child Protective Services because I actually don't particularly like adults, and I preferred to work with kids who didn't have too many adults stable in their lives. So I mostly worked with kids. Okay, sorry, I'm trying to read these. Absolutely, clinicians diagnose mental illness. PhDs do, PsyDs do, social workers do, MFTs do. We all use the same diagnostic and statistical manual as psychiatrists use. So yes, we absolutely all can diagnose. It's just the odds of you seeing certain kinds of diagnoses will vary based on your training, your interests. It's very unlikely that a counseling psychologist is going to be working with people who have schizophrenia. It's just not what they've been trained to do. If they got somebody like that, they would be well equipped to do the eval. They would definitely be able to recognize the disorder, and then they would refer that person to probably a clinical psychologist or a psychiatric social worker. Which type of psych job reports the highest job satisfaction? I have no idea. That's a great question. I mean, professors are very happy people in general. I know everybody thinks we're super stressed out, but it's extremely high job and life quality. I think it varies, but that's a great question. I should look that up, and I don't have that in here. Are we able to pursue an MS if our undergrad is a BA? Absolutely. You do not need the BS to attend an MS in psychology. There are, in some of the other fields, they do require the BS in order to access the master's degree, but not in psychology. What degree do you need to be a clinical psychologist? A clinical psychologist is a PhD or a PsyD. For school psychologist, it's going to be a school psychology degree. It is a PhD. There are not PsyDs in school psych. Or sometimes it's an EDD, a doctorate of education, but usually these days it's a PhD. At UCR, it's a PhD. My email, my first name is the weirdest name you've ever seen. So if you Google me, you will find me. It's just my first name at UCR. What counts as a school psychologist as in a university level or high school? So school psychology is referring to grades K through 12. It is not referring to college or universities. So typically you're talking about kids under 18. What jobs can you get with a PsyD? They are clinicians. So they can work anywhere, prisons, hospitals, private practice, community, but they are doing therapy and testing, and that's it. They're not typically doing any research. Main differences between counseling and clinical psychology. The differences are fewer than they used to be. Historically, as I mentioned, it's about the severity of symptomatology and some of the focus. So counseling psychologists tend to work with people who are a little bit healthier and are typically dealing with more normative life challenges. They are not typically as comfortable dealing with some of the more severe issues that present, like bipolar, schizophrenia, complex post-traumatic stress disorder. So they'll deal with an acute stressor, but people coming in with very chronic, severe trauma may or may not be comfortable for a counseling psychologist. It will vary a little bit. Informative response, but of course I have no idea what response, but I'm glad it was informative for you. Easier questions. Thanks, Alexa. Counseling psych is for less serious psychological problems and typical life stressors. That's Jenna from my class, and that's correct. Does the major GPA, presumably psych, count more than one's overall GPA than one's minor GPA? Yes. So we are very aware that many people started off because their parents or they thought they should be a doctor, like the kind that gets the MD. And so they did pre-med for 2 years, and then they realized that actually orgo sucks. And actually organic chemistry is really cool, but for many people it's just torture. And their GPA got a little bit tanked, and they found their true passion, and they switched over, and they did much better. This is why for most graduate programs, the admission, I mean, it's hard because we see the overall, and it definitely does influence us, but the actual decision to admit or not is most often based on your last 2 years of GPA. And that will often be your major GPA. So at UCR, for example, our cutoffs, at the graduate level, at our doctoral program cutoffs are 3.5 GPA for the last 2 years and a 3.08 on the GRE. But we have plenty of students who don't have that GPA and or that GRE. That's just what our preferred cutoffs are. If you're lower, we need to understand why, just to give you a feel. But I'm going to go over these kinds of cutoffs in a moment. So major GPA does count more than overall, and it just sort of depends. Industrial organizational psychology is actually its own. The question is, does it fall under occupational therapy? It does not. It's its own division of psychology. Occupational therapy is like rehabilitation therapy. The job of an occupational therapist is to assist somebody to either regain functioning after like a traumatic brain injury or spinal cord injury or something, or to attain a higher level of functioning because they have some kind of different ability status, like cerebral palsy, spina bifida, something congenital, etc. Why are there so few psychiatrists? I will tell you exactly why in just a second. Okay, so why are there so few psychiatrists? Why are there so few psychiatrists? I'm just going to be totally honest. Psychiatry is not well treated within the medical profession. It's stigmatized. Psychiatrists are often treated as sort of less than doctors. They're not your surgeons. They're thought to be, it's not true, but they're treated as if they couldn't make it as like a real doctor, so they became a psychiatrist. So it's not, when you're going through medical school, and I just had one of my kids go through, I should say, anyways, I run the big program here for foster youth, and one of our kids just finished and was really debating between a residency in psychiatry or a residency in anesthesiology. And one of the reasons that he went into anesthesiology, in addition to the fact that it's more money, so typically other MDs will make more money, is because of the sort of negative treatment and negative reputation that psychiatry has within medical schools. It's really sort of the bottom of the barrel goes into psychiatry is what the myth is. There are many incredibly talented physicians that chose psychiatry, even though they could have been any number of other kinds of different doctors or specialties. So that's one reason. Whereas in clinical psychology, clinical psych is thought is sort of the top of the field of psychology. So I think that's part of it. I think the job is tough. It sucks to see your clients 12 minutes at a time, 8 minutes at a time. Psychiatry used to have the option of therapy. It really doesn't anymore, unless you're seeing people who can afford, you know, $400 and $500 an hour, which typically the people we most want to work with can't. So I'm sure there are other reasons, but those are a handful. Okay, so clinical psychologist, PhD, research. Yes, you must have research. We're going to talk about that to get into a PhD. If I want to work with kids, teach, or work as a school psychologist, would developmental psychology be, okay, so great. Developmental psychology does not allow you to practice with anybody. It's a research degree. And that's like the number one thing I have to tell my incoming grad students. You can never practice with this degree. It's not quite true. You can get that PhD and you can go re-specialize and then be eligible to practice. But the re-specialization is so expensive and time consuming, you might as well have done the proper PhD in the first place. So no, you do not want a PhD in developmental if you want to be able to be any kind of a therapist. You will not be able to do that. Sorry. OT, the best way to get the coursework, if you don't have it, is through community colleges or post-bac programs. We can talk about that. And then, average living is around 60 to 70, but average, should I think about my future? Or is it more about my interest and desire? Money, you know, life's expensive. Keep in mind that what I'm showing you here are mostly start salaries. Okay, so yeah, an MFT will start at 50K, but they can get up to 100. You know, the social worker that I did much of my own work with, she easily pulls almost 200. So these are starts. These aren't the ends. So I don't know. I can't answer that question. The question really was like, do I follow my heart or do I also be realistic? And the answer is both. You know, some of you want children, some of you don't. Some of you have families that you need to provide for, some of you don't. Some of you have families of means and some of you don't. So some of you have more flexibility and some of you don't. So that's an individual decision. But I certainly, if you're thinking like 60, 70K versus 50, I wouldn't sweat it. You'll get to 60, 70 if you want to. Again, remember, you can pick who you want to work with. So you can make bank if you're working with wealthy people. My preference is to not work with wealthy people, so I'm never going to make bank, right? But that's okay, because I'll be much more gratified by my job. And I'm fortunate in that I, you know, have a home, I don't have children, and I have a wife who makes a good living too. She's a professor at UCR, playing freaking Animal Crossing right now. Okay, counseling psych, an MA or PsyD or PhD is needed. Typically for counseling psych, it's going to be an MA or a PhD. There are a few PsyDs in counseling, but relatively few. The reason is that counseling already is so much more practice oriented, they kind of don't need the PsyD. Difference between PhD and MA and school psych, like the one at UCR. The difference is one is research focused, so the PhD will be research focused. The MA program is going to train you to be like a guidance counselor at a school. The PhD program will train you to be a professor, to work for a district, to kind of oversee all those guidance counselors, to do the more sophisticated testing, etc. Can an MFT allow you to work as a school counselor along with families? Yes, you could. I don't think you'll find very many MFTs working in the schools. Mostly who you find in schools are school psychologists, either at the MA or the PhD level, and counselors. If you want to work with clients at all levels, your options are MA degree or clinical psych or counseling. If you want to work with clients of all levels, probably your best shot is the social work degree. So MFTs aren't going to be in a hospital setting typically, and they're not going to be dealing with the very severe pathology, and you want to work with all levels. So stick with the MSW or the clinical degree again, because counseling, the clinical degree meaning the PsyD or the PhD, because counseling tends to be more, you know, kind of normative life stressors. Yes, you need research experience, less so for the PsyD, and we'll get there. How important would you say doing research in undergrad is? Extremely important, and we'll get there. In a clinical setting, not all levels. Okay, in a clinical setting, not all levels. Clinical setting is too vague for me. There are too many of them. Any insight on becoming a physician's assistant as a psych major? Yes, to become a PA, which is a great job, you will need you'll need their prereq classes, which dovetail a lot with the pre-med classes, but you'll also need anatomy and physiology, which you could get at a community college. So if you're missing a class, because that came up, then you probably want to get it under your belt at a community college. If you're missing like a ton of classes, like you suddenly decide you want to go to med school, but you didn't do pre-med, then you want to do a post-bac program. The problem with post-bac programs is they don't have financial aid. All right, let's move on since we're caught up on some questions. Okay, so this is where we get to the major decisions that I think most of you are going to be struggling with. Should I get a doctorate or should I be a master? And what's in a name? So time. Your doctoral degree will take you at least twice as long. So time matters. I just will remind you that the average duration that we live is absurdly long at this point for most people. Not all of us have that luxury, obviously, and I recognize that, but for the average lifespan is long enough that you don't need to be worrying about time. I think women who are interested in having children worry more, but you have plenty of time to take your time getting your degree, whatever degree you want, and still have plenty of reproductive years ahead. But I know that there's like this time pressure that you guys all feel. I hear it all the time. I can't take a gap year. I got to keep going. And the worst excuse not to take a gap year is I'm going to lose my motivation. Because if you're that tentative in your motivation, then you need to really think about, is this what you want? Because there's going to be way more to get you off your motivation than playing Animal Crossing for a year. No, we'll talk about what you really should do in a gap year. Okay, so prestige. Some people are hung up on being called doctor. Technically speaking, I'm a doctor. If you call me that, I'll always correct you. I hate being called Dr. Yates. I hate it. I don't ever have my clients call me that. People don't typically know that about me. I just go by Tuppet because that's what makes me comfortable. But if you need to be a doctor, then obviously you need to get a doctorate. PsyDs are called doctor. If in terms of, you want to think about what you want to do. If you want to be a practitioner who does testing, then you need a doctorate, PsyD or PhD. If you want to do teaching as like a full-time gig as a professor, you need a doctorate. If you want to do teaching like just here and there, you don't really need the doctorate. Money, doctorates are paid more, but not necessarily a lot more. It'll depend who you work with. It'll depend where you work. And that's going to depend more about who you are as a person, what your values are, what you find gratifying than really anything else. Doctorates can be cheapest to obtain because, again, they can be funded. So I should just ask if folks can hear, because I'm noticing on the video that my video is stopping. Yes, okay, great. That's all I needed, sorry. Okay. Let's see. Thank you for letting me know. I've had some problems with internet today. Doctorates may be harder to gain admission. So in this book that I have down here, there are doctorates that will take 30%, like Pacific, whatever it is, Pacific something or other, but they're not high quality. I mean, they're not going to fund you, and they're not, among the higher quality doctorates. So I say may, obviously the good ones definitely will be harder to gain admission. We'll go over admission rates. Oh, look, there they are. So in terms of master's programs, you're looking at 50, 60%. PsyDs, it can range from, 20 to 60%. I mean, these are always sort of flexible numbers. But the doctorals in clinical, you're looking at 2 to 15% with an average of about 8. That's quite low. I don't know what the admission rate is for UCR, but it's probably 65% maybe. So these are hard degrees to get, which is why you need to apply to a lot of schools. And we'll talk about how many schools in a minute. So this is one decision, right? Doctor or master. And some of you, and we'll talk about this on the next slide, on another slide, will want to, I'm just checking time, will want to get a master and then go on to the doctorate. And we'll talk about what would determine that. Let me just see, I have a text here. Nope, that is just my wife texting me. Excellent. Okay. And then another big decision that I know a lot of you are wrestling with is the PhD versus the PsyD. I am a little bit worried about time, but hopefully we'll make it. Okay, so the PhD is more likely to be funded. So about 90% of PhDs will be funded versus 1% of private PsyDs. Now I'm showing you the polar opposites, okay? So there are definitely some PhDs in the middle that aren't gonna be as well funded, and there are a handful of PsyDs that are based at universities that do have some funding, but the high tier PhDs are almost all uniformly funded. The private universities where most of the PsyDs are, you're not going to get funding. PhD is definitely higher prestige. There's just no doubt about it. And I mean, the reason is that, you know, a PhD incoming class is 4 to 8 students. An incoming PsyD class is 40 to 60 students. The PhD going rate for admissions is 8%. The PsyD going rate for admissions is probably 50%. So it's quite dramatically different. PhD is definitely more versatile. You can be an academic, you can be a clinician, you can work pretty much anywhere. It is the highest of the high. And we match for internship at a much higher rate, which is a sign of quality. So, you know, 90% or more versus about 2/3 are matching for an internship. And then PsyDs will score lower on the EPPP, which is that national test you need to take for licensing. These are all reasons why PsyDs are lower, are sort of less prestigious. That said, if I wanted to see a therapist, I'd probably, well, I don't know what I would see. I'd see a social worker, to be honest, and I did see a social worker over anybody else because I think they're the best trained in therapy, actually. But I'd probably see a PsyD over a PhD because PhDs are mostly trained in research. So, you know, these are general statements. Some of the best clinicians in the world are PsyDs. And as long as you're not hung up on how other people are going to judge, and, you know, screw them if they judge. You got to do what makes you happy. We're going to talk about diversity in a minute, and I'm going to tell you the same damn thing. All right. Clinical PhD is definitely more challenging. You do have to do original research. You have to be able to tolerate research. All that said, most people with a clinical PhD go into clinical work. They do not go into the academy. When I went into the academy, I was like the first one in 5 years or something out of my joint program, and I was at a clinical science program. So, you know, the reality is practice feels to people more flexible. It feels less stressful. People get freaked out by the tenure process for the academy and so on. So you can do clinical work, obviously, with the PhD, but to get the PhD, it's going to take you some work. So 175 PhD programs, they take an average of 4 to 10 students. 75 PsyD programs, they average a higher number of students. And that, for that reason, more than half of the clinical doctorates being awarded are PsyDs. So PsyDs are not rare at all. They're very, very common. That then makes them slightly, you know, slightly devalued. The very best clinician I know is actually an MFT. Well, one of the very best clinicians. So, you know, I'm saying general statements about who makes the most and who's in highest demand and what's highest status. And but you as an individual can be whoever you want to be with whatever of these degrees. Counseling versus clinical versus the PsyD. So counseling, again, typically focusing on less severe disorders. There are fewer counseling programs. And as I mentioned before, there are very few counseling PsyD programs. And that's because the counseling programs as a whole already have a much stronger clinical emphasis as opposed to a research emphasis. It is easier to get into the counseling programs. You know, about twice as easy so about 2 times easier than the PhD, but about half times as hard as the PsyD. I don't know what that is saying, but you get my point. Easiest to get into the PsyD, then the counseling, then the clinical. That's the point. It is somewhat less marketable because, again, it's not kind of as prestigious, but it's very well respected. You'll definitely find work. They do make a little bit less money. And in terms of the graduate training, it's better funded for sure than PsyDs, but less well funded than the clinical PhDs. You're thinking about a master's, an applied master's. We're going to talk about master's in general psychology that you would do to prep for a PhD in a second. But should I be an MSW, an LPC, licensed professional counselor, or a PCC, professional clinical counselor, or MHC, mental health counselor, or should I be an MFT? They're going to cost you about the same. They all take 2 years. They're all at MA programs. Typically, like in California, you'll find these at the Cal States and a couple of the UCs. The UCs will cost more. So most of my kids who get into both end up picking the CSUs because you don't need to pay a lot of money for these degrees. Prestige, the MSW is the highest prestige of these, not by a ton, but certainly it is. It is definitely more marketable. just go to Glassdoor, look for the number of jobs with each of these words in it, and MSWs are hugely more marketable. Because an MSW can apply to any job for an LPC or an MFT, and MFTs and LPCs can apply to some MSW jobs, not all. But the MSW just is the most versatile of the MA level clinical degrees. It is slightly more difficult. They are slightly more selective overall. There is more funding for the MSW, and it's a bit easier to find paid practica sites. So again, you do these practica sites as part of your clinical training. It's unusual to get them paid, but MSWs will have more of them. And then of course, there's slightly higher salaries. So 57 versus 53 versus 50, according to Glassdoor in LA in 2020. But that's consistent with what I reported when I did this similar talk 10 years ago. So it's not, it was just cheaper then. The rates were lower, but same order of hierarchy. Should I take a gap year? Yes, but mind the gap. So yes, gaps are great. I know for many of you, especially coming from families that aren't familiar with this idea of taking a gap year, you'll really be coming up against some pressure from family. But gap years are highly recommended if you use them wisely. And the reason for that is we generally prefer students who are clearly have thought about their path and who are a little bit more mature. So if you're a transfer student and you already have a couple years under your belt, maybe that might be helpful. But for those of you who are, 21, 22 and totally wet behind the ears coming out, it's hard. I would favor an older applicant because they're going to have a little bit more life experience. They're likely to fare better in the clinical setting. Clinical work is extremely challenging and nuanced. So yes, taking a gap year is a great idea, but you got to do something good with it. If you want to go for a PhD, you need to be doing research. It doesn't really matter if it's volunteer or paid. Doesn't really matter if it's 40 hours a week or it's 10 or 15 hours a week. What does matter is that you are getting experience that helps you to understand the scientific process, and you can communicate that in your personal statement. We're going to get to personal statements. It helps you get a sense of what you do or do not want to do, and ideally is getting you some letters of recommendation. So I don't know if this will open, but this is the best place to find research options. And it's this place, I'll give you the link, I've given you the link. It runs through this clinical site, grad school link or whatever site. And what you can see, these are paid full-time gigs. These are looking for, these are people looking for lab managers and so on. And then you also can post senior looking for RA and post-bac opportunities. The reality is people aren't likely to post to you as readily, but if you want to find something like here, research assistant position with the largest study of adolescent brain development in the nation, apply. Here's the trick. This is the Medical University of South Carolina. If you are willing to really pursue your dream, you will be able to make it. But the many of you I talk to that want to stay in California, you're really in trouble. Because in California, the only decent PhDs, the only good PhDs, reputable PhDs, by and large are Berkeley, LA, and San Diego. Irvine is opening a new clinical PhD. They'll be accepting admissions, I believe, for their first cohort coming in 2021. But these are programs that are taking 2.9% of their applicants, 4% of their applicants. It's very hard to get into the PhD in clinical at UCLA. And so then the other PhD programs here are clearly substantially lower. So Loma Linda has a PhD program. It's a perfectly fine education. You're going to pay for it. And it has some religious connections that may or may not be comfortable for you, although not terrible religious connections. There are some other schools that, would be really hard for certain groups. I happen to be gay. Like I couldn't go to some of these schools, obviously, like Azusa, which is very conservative religious. I could if I wanted to live in the closet, which I don't. So we'll talk about diversity stuff. Anyways, long story short, there are incredible opportunities. And yes, some of these are in California, but you have to do what you have to do. But generally speaking, the advice for PhDs is to leave. You will have way better opportunities out of state. And especially if you're willing to go to places that aren't hugely popular, like North Dakota. Okay, so research experience, there are many other ways to get it, but that's a great site. Or clinical or practice experience. Again, volunteer or paid, they don't really care. It is not terribly important for doctoral work. They'd like to see that you have some human experience, but it could be like, you know, one of your groups on campus, or it could be volunteering as a tutor. It doesn't have to be like full-time intensive. Social work and some of the more PsyD type programs are going to be looking for more clear clinical experience. So you could do ABA, that's the most common, I think. Rape crisis is pretty common, the suicide hotlines, working in different shelters, homeless, domestic violence, working for non-profit organizations. COVID, I know COVID is a nightmare. So we'll talk about that. I have 22 comments. I think I'm getting to questions. So let's hope that I get to a question slide in a second. Okay, just real briefly, think about other options. Psych isn't your only option. You can get a master's in education. You can be a teacher. You could be a school psychologist. You could, you know, do research in school settings. You could do program development and evaluation. I just think it's a whole, graduate schools of education are a whole world that many of you haven't thought about. And the other one that you rarely have thought about, especially because we don't have a BSN at UCR, but that doesn't mean you can't become a nurse. I have one of my kids who's doing her nursing degree at Johns Hopkins right now. No problem. She did post-bac work at the community colleges to get her requirements and then got into Johns Hopkins. So it can definitely be done. This is the link for psychiatric nursing, but nursing in general is a great field. Nursing, even though we have psychiatric nursing, nursing as a whole has a huge mental health component, obviously. You can do it master's level, you can do it doctorate. Oh, great. There are 28 comments. All right, hold on. I'm getting there. Lots of subspecialties. As I mentioned, you can prescribe at some sites, and there are a number of programs kicking around for nursing. And then the other one would be occupational therapy. So this is a really great job. Their goal is to really help people either restore full functioning or attain improved functioning for people with various disabilities, either congenital or acquired. And this is a link to learn more about OT. Whatever you decide, you must please go with accredited always. And that's not the same as approved. Approved means like, yeah, it looks okay, but accredited is a formal evaluative process where the overseeing organization, whether it's MFT or it's psychology or it's social work or it's school psychology, which are those acronyms there, is saying this program meets the minimum standards to be license eligible in this chosen career. Online education, be very careful. I know like USC has a very popular, there's the word I was looking for, online social work program. I think most of us who are trained in the real world are skeptical of training clinicians online. Like I understand if you're in, you know, remote Alaska and Juneau, that makes sense to me. There's a need. Otherwise, there's not. For most of you, some of you have extenuating circumstances that would make online more accessible, but you all know because you're experiencing it right now. This experiencing we're having right now is nothing like it would be in a classroom, in an auditorium. All of your classes right now, think about the education you're getting right now. I know for most of you, you feel disconnected. You don't feel as engaged. You're struggling. It is not the same. Now, try and learn therapy that way. It's so online education options, they definitely exist. You can, I mean, at the master's level, you can do this. There is only one PhD that has some kind of accreditation. That's the Fielding Institute, and obviously you'd pay out the nose to do it. So online education, I would limit it only to the MA level programs, and I would avoid it at all costs, to be honest. And certainly if you do it, make sure, like USC's is fine. The Cal State ones are fine. But be very careful of all of these for-profit schools that won't be there by the, you know, Branford or Brands. I mean, you saw all the tremendous controversy 2 and 3 years ago about these schools. And then also be thinking about if you know you want to be in another state, just take a look at what their requirements are, because different states require different graduate level courses. So like if you do your clinical psych degree here and you want to go work in Massachusetts, you'll need to take 2 more courses. Because they aren't typically offered in the programs here in California. It's not a big deal. You just go and take them when you get there. But just, it's good to know if there are particular state-specific things, especially if you know you're likely to move there. Ah, good questions. There's 43 of them, so give me a second. Look at the cute puppies, though. All right, hold on. We are 2/3 of the way in, and I'm at like 8:30, so we'll just see how we do. Yes, I can hear. Should I take over from there if we wanted to? Okay, interview. I think we're here. What is the difference between a PhD and an MA program in school psych like the one at UCR? We talked a little bit about that. So somebody asked me a specific question about a program here, and I don't know where it was, like cognitive behavior stuff. You might have to email me that privately because I don't know where your question went, so I don't know what it was about, or just rewrite it. Can the MFT allow you to work as a school counselor along? Oh wait, we already had that one, sorry. Sorry folks, I'm getting there. Here we go. If we want to, what if we want to do undergraduate research but don't make it past the interviews to get into a research lab, you mean? You know, it'll depend why you're not, I mean, you certainly can write and say, why am I not getting past the interview? Some labs are just really popular. A lot of us have GPA cutoffs, but otherwise just apply again, because the reality is we get so many more applicants than we can accommodate. And it's true right now because of COVID, and we can talk about COVID and kind of how to deal with this. You know, right now it's particularly challenging because most of us aren't taking RAs, because I can barely hold the 40 RAs I've got, you know, with online crap. So this is just super crazy times. There are some other things, which is my understanding from most graduate programs that I've talked with, and I'm the graduate advisor at UCR, so that's handy, is that they are not going to be considering grades for spring quarter this year as part of it, like when they look at GPA and application and stuff, because they recognize that this is an insane time. So that'll put you at ease. Likewise, you know, we don't know what's going to happen with the GRE. My understanding is it will be takeable from home. But for example, in China, the GRE shut down this year long before, like when our application portals were still open. And we waived the GRE for everybody, of course, right? Like, I mean, the world is not stupid. So you guys are all coming of age at a really challenging time, but the graduate programs are aware of that and are trying to accommodate appropriately. So a lot of schools probably won't be having, like our MBA program waived the entire GMAT this year because they, you know, so many people couldn't get the test. And I just got an email from somebody overseas who can't get the test for the GRE. And I was like, of course we won't. I mean, for one thing at UCR, we're not going to be using it anymore, but anyway, so we'll get to COVID stuff because I know there's going to be. So what if you don't make it past the interviews? Keep trying and follow up and see why. Can you teach with a counseling PhD degree? Yes, so it's a PhD. You can teach in a counseling program. And in fact, like my kid, I had a kid who went from UCR to UMaryland College Park, it's a popular place apparently, to their counseling PhD, and now she's a professor at Ohio State in a counseling PhD program. Is there an MA degree for clinical psychology? Yes. And what would you do with it? You would either be doing research to prep yourself for a PhD. Some of our doctoral students come in with an MA in clinical psych, but they've done research mostly. Or you would use it, and then with that you can sit for the MFT. So like Pepperdine has an MFT track, or you could sit for counseling, like an LPC, a licensed professional counselor. The only thing you can't do is social work is like the guild, right? Like you got to go to a social work program if you want social work. Can you change your graduate program? It is not the same, you're correct, as changing majors. You can, people do. We had a kid who went from education to psych back to education. There are also kids who, students who start with one PhD and decide they want to go to but you have to apply all over again, and you don't take any of that credit with you. So you don't really want to, you can't like change your major and stay at UCR. You'd have to apply to another program and get in. And sometimes that works and sometimes it doesn't. If I want to work with kids, but I also want to pursue a PsyD. PsyDs have child tracks, no problem. Just look for one that has a child track. If you need classes for PA or med school, is it smarter to do it at UCR or at a community college? It depends how rich you are. Absolutely at UCR if you can afford it. Absolutely at community college if you can't. Or do a post-bac, but same problem. It's just really, you know, they're very expensive. But that's fine because then you explain. It's not, you know, people know the reason you're doing it isn't because you couldn't do it at UCR, it's just money. When was I able to finish my studies? So I what did I do? I went to college for 1 semester and I dropped out for a year and then I went back. So I was a year older than you're supposed to be. I guess I was 23. Then I took 2 years off. I worked 1 year doing research on memory and child sexual abuse. And then I did 1 year doing rape crisis work as an advocate. And then I went to grad school. I started at 25. I finished at 30. I did my clinical stuff and I started my job here at 31. This is my 15th year and I'm now 46 years old. Scary. Okay, so that said, you know, one of my grad students is already 30 when they started. It is not, especially at the doctoral level, it's very common for people to take 3-5 years off doing clinical work or research and then come into the grad programs. Likewise, when you finish your PhD, I went straight to the professoriate, but it's very common to do a postdoctoral research internship, especially if you're interested in like neuropsychology, which is, you know, more sophisticated testing aimed at trying to understand how injuries to the brain, for example, might influence functioning. Or imaging. So Kalina Michalska, who's one of our faculty, she postdoced for, I don't know, probably 5 or 6 years to learn all the imaging things that she needed to know in order to run an imaging lab. So it just depends, but it's not uncommon at all to start as a professor in your mid-30s, in your 40s. You know, again, we live a long ass time. Okay. Yeah, keep applying. When were you able? Okay. Pretty sure you can't practice with an MA in clinical. You can practice with an MA in clinical if you sit for a licensing test. So you still have to get your license, your supervised hours, but with an MA in clinical, you'll qualify to sit for the MFT test or the counseling test, depending upon kind of your clinical degree. But you can talk with them at the MA in clinical program. The most common one that people around here do is Pepperdine, and they definitely have an MFT track and they might have a counseling track. So yes, but you have to do the licensing. Less severe disorders, what constitutes them? That's an excellent question. More severe, less severe. I mean, there's very, very severe general anxiety, right? But the more severe disorders are typically those that are thought to be persistent and potentially have psychotic features. So those tend to be schizophrenia, bipolar, complex PTSD, which means trauma that's particularly severe, enduring, childhood onset, intrafamilial, all of the above, none of the above. Some cases of obsessive compulsive disorder, some, you know, panic disorder can get that bad, et cetera. But typically, you know, it's what you would think of. The less severe would be, you know, major depressive disorder. Obviously it can get very, very severe, but likewise panic attacks, PTSD, acute stress disorders, some of these can also be less severe, meaning people are pretty much able to maintain their day-to-day functioning, albeit with some struggle. Okay, would an MSW give the same work opportunities as an MFT? Everything an MFT does, an MSW can do, but not everything an MSW can do would an MFT do. So MSW is going to be the broader. Volunteering and research, if you want to pursue a PsyD, it'll depend a little bit on the PsyD that you're looking at, but it definitely would never hurt. We all research for social work, research. Everybody wants you to have research experience because we all value what's called evidence-based practice. We all value any practitioner of any kind who can read the literature and understands the value of science. This is a great research site. Is there one for other fields? I do not know. You can find a lot by Google. What volunteer experience do you recommend if you're looking into an MSW? So MSWs are unique in that they have a very strong social justice orientation. And one of the questions on the MSW application will often be, what is the big issue that you're most interested in? Homelessness, poverty, racism, health disparities, whatever it might be. So the best work you can do with the MSW for the MSW is something that's social justice related, right? So work in juvenile justice, work at a shelter with the homeless, work for some kind of a think tank or a nonprofit aimed at, you know, gender equity or violence prevention, or Truevolution, which is targeting HIV/AIDS prevention in the LGBTQIA community. But that's more social work. And what they really want is whoever's writing your letter, ideally you'd have 2 professors for social work and 1 social worker. So it'd be great if you could work somewhere where your supervisor was a social worker. What about for a master's? Does California have good programs? Absolutely. California has great programs in everything, but so do other states. And getting out is a great thing. Suicide hotline. Yes, that's a great option. Do you need any state licensure testing if you do your clinical program in another state other than California? So everybody takes the national test for social work, for MFT, for counseling, for clinical, whatever it is. And then you always will take a state test. And the state test is short, and it focuses on state-specific policies, because every state has a different child protection policy, TerraSoft policies, et cetera. Jasmine, if you already have some research experience, volunteer, that allow you to develop. I recommend what Darian said. The crisis text line is, yeah, so we'll talk about that in 2 seconds. Yeah, so a little bit of research goes a long way for everything. How has being a volunteer been? This says you guys talking, very extremely rewarding, great training. Sorry. All right, you guys are talking to each other so much. All right, how do we apply? Oh my God. Oh my goodness. Okay, somebody's gonna have to tell me if there's, oh wait, there's a recommendation for PsyD programs. I do not, I don't know much about them. I recommend the book, which will tell you everything you need to know. Generally, the harder it is to get in, the higher the GPA and the higher the GRE, and the better the funding, the better the program. Geez. Are the pass rates for those exams low? No, not terribly. And yes, if you don't pass, you just take it again. You do have to stop. What are the job limitations? That's a hard question. I don't know. I don't know exactly what that means. What are the job limitations? I mean, there are job strains. It's a hard job. Freaking most annoying thing is all the damn paperwork when you're in practice for insurance companies. If you are graduating, you can still do research. Half my lab has graduated. So you can apply for research labs even if you've graduated. All right, let's move on, but know that we will keep, there's one more period for questions at the end. We'll just look at the puppies again because they're so cute. Okay, so the third part of this is to act, and we are at 8:34, holy smokes. All right. Oh, shit. Oh, you didn't hear that, sorry. Okay, what matters? You need a transcript. That's part of your application for all of these things. They're looking for good grades. We'll operationally define that in a moment, but ideally stable or improving over time. Bad if you have a decrease, except for in the COVID era. But of course, people have illnesses, people have deaths in the family. That's fine. We'll talk about how to navigate that. The last 2 years tend to be more important than the first 2. GRE scores, or for med school, the MCAT. We'll talk about the GRE at some length. Not all schools require it. Master's levels, about 50-50 require it. And some schools only require it if your GPA falls below a certain level. So you just have to kind of read the fine print. All of them will require a personal statement. Typically, you'll need 3 recommendation letters, and then there's all the other stuff, right? So research experience, clinical experience, your service to the community or to your college, different organizations that you're part of, a thesis, whether or not you're in formal honors, conference presentations. Our psych's deadline, I think, is Friday. It's not too late, etc. So we'll talk about how you get all this. And then in most PhD programs, you'll need to interview in most PsyD programs and in about half the social work programs, and maybe a little less than half for counseling and MFT, but interviews are pretty common. We'll talk about that too. So, you know, what matters? It differs. It differs across schools. It differs a little bit between master's and doctoral. Letters of recommendation are very important. So is the personal statement. And so is GPA. I mean, when you just kind of look at what people value, not surprisingly, doctorates care more about research, but look, even at the master's level, they care more about research than they do clinical, than they do service, and then they do work experience. So research is important. The interview is important, especially at the doctoral level, etc. This varies a little bit too, depending upon what group you're a member of. So for example, the GRE scores are typically weighted lower for historically marginalized groups, English language learners and underrepresented ethnic racial minority groups, because remember, we're scientists, so we know the data on how culturally biased these tests are. So even these numbers will vary a little bit depending upon who you are. So what courses should you take? Courses are typically rated as required or recommended. And remember, sometimes there's fine print in that the requirements vary depending upon whether you're a psych major or not, or what your GPA is. Statistics and research methods by far are the most important grades you can earn and the most important classes you can take, followed by abnormal for clinically relevant degrees. And then it kind of, you know, dwindles down the line. Your grades, I have no idea, but these are some data. In general, you know, this is the minimum for doctoral programs. This is all fields, not clinical necessarily, all psychology fields, is a 3.1. But when you actually look at what the average grade is, it's a 3.5. The psychology grade that's required is a 3.26, but the actual psych GPA is above a 3.5. And then at the master's level, you'll see they're proportionally lower, but generally speaking, and I'll give you kind of some basic advice about this. 2.9 is kind of the minimum, 2.8 for some MA level grad programs, but it starts to get just about impossible when your GPA goes below that. And because you can see that the actual GPAs that they're getting are higher. There is some difference, by the way, if they're looking at a GPA with a biology major versus a sociology major. They will count that a little bit differently because it's known that GPAs in certain majors are lower. What do you need for GREs? Not entirely sure, but generally speaking, they need to be pretty high. What they're looking for in the clinical programs is GREs at the 75th percentile. Substantially lower, it says PhD and PsyD, but actually that's for PhD. I should take out PsyD. PsyD tends to be more at the level of kind of the masters. A lot of them don't require it, and they certainly don't expect them to be that high. If you had scores like that, you wouldn't go to a PsyD because you could get into a PhD potentially. But those are fairly high. That's a 310. Master's programs in psychology, and this is about where I put the PsyD to. You're looking for a 295 to a 300. We're going to talk a little bit more about the GRE and its scoring and things like that too. Bottom line, my opinion, totally my opinion. Others would say different things potentially. For the clinical PhD, you really should have a 315. 312 would be fine. Your cumulative GPA should be a 3.5. It's going to be very challenging without that. Non-clinical PhDs, it's a little different. So I'm giving you the criteria for UCR. Actually, this is lower than UCR. It's 308 in our department and a 3.5. But we do take plenty of students with 3.3s. And we also take students with 306s and 300s even. So no one thing keeps you in or out. And we'll talk about that in a minute. And then for the PsyD or the MA, I'd say around 300 and a GPA of 3.0. Okay, normally I'd pause for questions, but it's too complicated. We'll get there. Diverse applicants. So diversity is complicated, particularly in the state of California, whereas many of you know we do not have affirmative action. So no decisions can even be considered based on ethnic racial minority status, which is super annoying. But that doesn't mean that in other states it wouldn't be considered, and it doesn't mean that there are ways in which that those considerations do come into play. So underrepresented racial ethnic minority, URM is that acronym. You should be aware of what those groups are and are not, but these are groups that are thought to be underrepresented numerically in the academy, and typically they've been historically marginalized via structural disadvantage. So structural racism, discrimination, and so on. LGBTQIA is also a diversity consideration, and more people do disclose this in statements, and we'll talk about personal statements. If you're going to disclose anything personal, you better have a reason. It can't just be, by the way, I'm going to just disclose this. Now, a lot of schools more and more, including UCR, has a special section, where we ask about in what ways do you contribute to diversity? And that is appropriate there to say, I'm a member of X, Y, and Z groups, and this is how it's informed me. But if they don't have that and you're putting it in your personal statement, it needs to fit. It can't just be like a, by the way, I am XYZ. Generational status, either with regard to education or immigration. So first generation status, being an immigrant, these are all things that factor into diversity considerations, and we'll talk about what that means. SES, so being raised low income, you'll see on the UCR apps, we ask single parent family, we ask, are you a single parent yourself? And we also ask, did you attend an inner city high school? Okay, so these are the groups. The other one that is not mentioned here, which was totally my oversight, would be disability status. Somewhat my oversight and somewhat an issue. I'm going to show you some more diversity. There are very little resources for people with physical disabilities in terms of, like you'll see there's all special divisions of APA for all of these different groups, but there's not, there is a special division for like research on intellectual disabilities, but there's not, and there's a committee to protect people with physical disabilities, but it is very complicated if you have a physical disability, whether or not to disclose that and how to disclose that. And when you get to the decision phase, then you can be much more vocal about your needs. But it's a bit of a dance in terms of, you know, how you manage stigma against underrepresented groups, including those with physical disabilities, with the desire to be authentic. You note that I'm not mentioning psychological disabilities here or learning disabilities, because that'll come up when we talk about personal statements, and it's a very challenging decision. But my advice, speaking as somebody who's made it, so it's hard advice to give, it's be who you are, because, well, A, we wouldn't want you to be anybody else, and B, you don't want to be somewhere that doesn't want you. Happiness is really important to success, and if you land yourself in an unhealthy environment because you're so focused on status, you could really run yourself into some deep, deep trouble. So when I went on the job market, everybody was like, whatever you do, don't tell them you're queer, and don't tell them you're married to an academic, because that's a very complicated thing, right? It's hard to find two jobs. So I went on the job market and I said, by the way, I'm a dyke, and my wife is a, dyke is a word we used back when I was young. I know nobody uses it anymore, so I'm sorry if that just totally offended everybody, but it was very popular when I was young. But basically I said that, and my wife is a sociologist. So I didn't get plenty of jobs, I'm sure, because of that, but you know, I wouldn't have wanted them. And in fact, when I was at Penn State, I asked very clearly, like, what would happen if my wife and I walked down the street? And they were like, it would not be safe to do here. And I was like, then I don't want to live in Pennsylvania. So, you know, but I had a lot of choices, and I was lucky to be able to do that. So my advice to you is think about what you need and what you can tolerate. But in general, I recommend being true to yourself, because it's just so unhealthy not to be. And there are places that will accept you. And the majority of them will. I think things are getting better and better with regard to that. Undocumented status to typically students, that will naturally come up because we ask about citizenship on most applications, and it does make you not eligible for certain things, but it's not a big deal. You are eligible for all the same things every other, you know, treated as international student is eligible for. So I wouldn't worry too much. It definitely does not make things easier. I shouldn't minimize that, but again, you got to be who you're going to be, so, or who you are. Targeted opportunities. There are special opportunities with regard to recruitment for grad schools, mentoring in your profession and getting into grad schools, and funding. So there are campus visit programs. So Stanford, Michigan, UNC Chapel Hill, Minnesota, a lot of them will have special campus visitation programs targeting underrepresented groups. That does include first gen, that does include queer, that does include immigration status, as well as, of course, ethnic racial minority groups, and physical disabilities. They will never list it, but they do count. So if you have a physical disability, you should be applying to these groups. You are underrepresented in the academy, and your voice definitely is valued and needs to be heard. So any group you should be applying for. Conferencing programs, so like certain conferences like the Society for Research in Adolescence has the so-called Millennium Scholars. These are underrepresented scholars who are paid, you know, their travel, their accommodation is paid, they're given a mentor who can help them through these processes. I mean, it's really very valuable. There's also separate funding. So there are minority fellowships through APA. The Ford Foundation is dedicated to providing graduate school funding for underrepresented groups, primarily ethnic racial groups for that particular foundation, et cetera. So just know that there are a lot of special resources and you'll need to hustle to find them. A good place to start, however, is here. So I covered just about everybody, but as I mentioned, there's not a division for physical disabilities. So I referred you to the Committee on Disability Issues, and that would be a good place to go to sort of get advice about how to navigate things. These are the Society for Indian Psychologists is American Indian or First Nation. Asian Indian would fit in the Asian, oops, now I've advanced, in the Asian American Psychological Association. So just a note about diversity and being aware of it, paying attention to it. You interface with the application process a little differently when you're applying versus when you're interviewing versus when you've actually gotten it. I seem to have clicked to these groups, which is lovely, but not my intention. So let me see. Whoa, all right, I'm gonna stop touching things. Okay, personal statements. Okay, so personal statements will be asked for all of these programs. They vary in length. I would say actually social work has the hardest ones. They tend to have multiple questions, like 4 and 5 essay questions, and they tend to be just difficult, like pick a social issue and how you hope to address it in your career. All the doctoral programs, it's just one statement, and it's typically, 2-page summary of your experience and how your experience informs your current goals and interests. So why are you pursuing the degree that you've selected to pursue? How have your experiences culminated in that decision or guided you towards this path? What do you want to gain? What do you want to accomplish by attending graduate school? What do you want to do with that knowledge once you've got it? And then more importantly, how will the program you're applying to advance you to that goal? Now the standard layout is everybody does a little hook. Usually it's some personal narrative of something or other. Then there's like some list of all your experiences. And then there's a final paragraph that's like, I want to go to this school because. Shake it up a little. We've seen 1,000 of these, right? So it's very refreshing when somebody starts with, I am seeking, oh, can you mute yourself, folks? I am seeking admission to such and such school because, and you start with why you're going there. And my confidence that this is an excellent fit for me derives from a variety of professional and personal experiences. Then you talk a little bit about your experiences, not what they can already see on your resume or your vita, but really the skills that you've gained and the way in which your interests have been refined, whether they're clinical interests or their research interests. For the PhDs, they're really looking for evidence that you know how to formulate a hypothesis, that you understand the research process, ideally that you've done some work to test and answer these kinds of hypotheses. You don't have to worry a ton if your undergraduate or post-bac research experience isn't an excellent fit, because we know that you're stuck with whatever your particular college or university has on hand. So, if you want to study LGBTQIA folks, you're not going to be doing it in the psychology department at UCR in all likelihood. We do have one study that's running about partners of some persuasion, but we don't have any experts on that here. And that's fine. What we're more interested in as you apply to graduate school is that you've got research experience, and that research experience has helped you understand how to ask and answer a question. I think a mistake people make is they get too personal. It is called the personal statement, and hooks are lovely, but they tend to get a little sing-songy. So if you're going to have a hook, so to speak, you kind of want to make it an interesting one. And not all of us have such interesting lives, and that is okay. The best statement I ever got was from a highly privileged kid coming out of Penn. She got her degree with me. She's now a tenured professor at CSUN, and she said, I spent my first year of doing research spinning people in office chairs and testing whether or not they could find their way to a dot, right? So she was studying like visual spatial integration or something. And she basically said, I've never been so bored in my life. Then I went to work for the Bic Razor factory. Also horrible, and then just kind of, it was like just this very funny, honest depiction of how she stumbled her way to the passion that she had. She came in with 5 years of research experience that was relevant. So she kind of culminated in that. But she was very, and I also like the statements that are like, you know, I've been very fortunate to be well supported in my education, both emotionally and financially. And I have no problem with the statements that are, I've overcome a lot of difficulty. I had a statement that was similar, but it needs to be done very carefully. No detail. You kind of allude to challenges, but you don't need to say what they are in great detail. Remember, these are people who have never met you. And especially for clinical stuff, we're clinicians. So we're looking for any red flags about poor boundaries or people not being kind of together enough to manage the stress of graduate school, particularly clinical work. So we'll go over some more of these specifics. So statements with typos are just a death knell. If you struggle with that at all, just go to the Writing Center, have friends proofread it, try and have professors and clinicians read it, especially if you've done any kind of self-disclosure, which we'll talk about. Be clear, be organized, be careful. So this is where it comes to self-disclosure. You know how I just said, like, I think most places are pretty okay if you say you're queer or you're from this underrepresented group or you struggle with this particular issue. They are not okay with mental illness still. They really aren't. Even me, and I have one, right? So, and I'm very open about that. I'm very open, you know, that I've done therapy and that I take medication. I'm super comfortable with that. When I see it in a statement, boom, flags are up. Because I would never say that in a statement because I don't know these people. I mean, I don't know you either, but you can't hurt me. And I think it has a point. Like, I want you to know that you can make it even if. So, I would never disclose my own personal psychopathology, even if it's in the past. And that's not, you know, that's just because the stigma is real. And because you don't need to. You can say, I think in my statement, I said something like, my interest in risk and resilience stems from my own encounters with both. And that's all. You know, I happen to have had a dead parent, which is like a safe thing to say. And so I did mention that. I left home at a very young age and I mentioned that. But I didn't say why. I mean, yeah, but I've had lots of statements that do say why and bam, they're out. So this will be very hard, but there is a way to communicate that, you know, you come to this authentically and honestly for reasons that they can trust are your own. Without telling them what they are. If you have a very unusual background, and of course I run the foster care program, well, actually we have a great director now, but I'm the executive director of it and I started it. So those kids have very unique backgrounds, right? That program serves kids raised almost exclusively in the system. And I write their letters of rec and I talk about that background. My students don't. They might reference that they're former foster. They might reference that they aged out. They don't say anything in detail. I do it. So if you have a very unusual background for one reason or another, the best way to handle that is to have a letter writer who knows you very well and can appropriately share some pieces of it so that you do not have to. And that's a complicated conversation that you would have with somebody who knows you well. We'll talk about how to meet those people. Be confident, but don't be arrogant. Be humble, but don't be tentative. Try to have a narrative. And so this is where we get to ethics. Poetic license is allowed and even appropriate in some ways. You do want to create, you know, most of our lives are a mess, right? Like, I have no idea why I joined that lab versus that lab. I don't even know how I ended up in neuroscience instead of, you know, and then I ended up over here. But when I tell the story on an application, I make a narrative that makes sense. There's no lying in it. There's just a few bridges that I've woven in, right? So my experience in neuroscience research, because I did like, you know, rat research looking at the mediation of Parkinsonian side effects from medication. I somehow, I don't even remember how, wove that into my clinical interests, right? I guarantee that at the time I didn't have those thoughts, but you do kind of need a meta story or a narrative arc. And it is okay to smooth things, right? It is okay to leave certain things out. the summer you spent working at the Gap. You do not need to mention it. It doesn't fit the narrative, right? There are other, so poetic license is okay, just be very careful. You do want to be truthful, absolutely, but you also want to have it be a coherent story, and that means not every piece of your experience will fit, and that's okay too. Best way to write these things, I think, is to take a deep breath and know that you're gonna write it a few times. The first one I wrote, I showed to a friend, and she was like, you have to start all over. And I went home and I cried, and then I did it, right? But I think these days, the best way to do it is to talk. Get your phone, press record, and talk. Just talk. Just verbal diarrhea it. Whatever comes about why you want to do what you want to do and what you want to do, and just talk. Because you can talk faster than you can write, and you don't censor as much. And talk like you're talking to a friend. And then type it all out verbatim, and then start putting the pieces together, and leave 6 months to write your statement. Don't leave 6 weeks or 6 days. The number one thing people do wrong is they try and get this done, you know, they leave 4 weeks to do it. The statement is the thing that will take you the longest. They are so hard to write. They're just so hard to write for everybody. I hate them. But it's very, very important, as you saw in the rankings. So how do you get the extras? Research experience. So you're a fourth year, you're graduating, apply to labs. We take grads. You're moving home, apply to labs there. I have a student who's finishing her MSW at Cal Baptist. I have a student who went to UCI. I have students in the lab who come from all different places. It's fine. Especially because I don't pay them. So as long as you're willing to volunteer, remember, you only need to volunteer like 10 hours a week. You can still work a normal job to pay the bills. There are, of course, lots of opportunities at UCR, mentored summer research internships, et cetera. That program is not running this summer. I'm really sorry. But then there's this cool resource. Well, this is the labs off campus. Oh, I have a whole nother thing. Sorry, that one I already showed you, but I have a whole nother one that is summer gigs. So I'll show you that. Clinical experience. During COVID, your best option is going to be hotlines, rape crisis, suicide, the texting line. Truevolution, which I mentioned, is HIV prevention and support, and also services sexual minority populations. They also are taking online interns, but it is hard. You just got to call around constantly. You know, the residential programs, so this is like group homes for kids, for example, they are hiring. They're essential personnel, you know, but it's about your comfort level in terms of exposure. But a lot of my students are doing applied behavior analysis still, or residential programs, et cetera. So there is work, and there are volunteer options, but you'll have to do whatever is sorry, my wife is making lots of noise. Hang on a second. What are you doing? Okay, could you just close it for another little bit? Okay. Okay, she is playing with a ladder. That was very loud. Okay. Professional experience. So attend, or even better, present at conferences. Go up to people. So the best conference you can attend is probably APA, the American Psychological Association, because that's the most clinically oriented conference. Although if you want to do social work, go to the National Social Worker Association conference. NASP has one too, National Association for School Psychologists. So if you can, go. Introduce yourself to professors, introduce yourself to people. And then the other thing is take your time, especially for the PhD. Don't feel like you need to rush, because you need to study for that GRE and prep your materials, etc. So summers. All of these links work, which is great. So APA has a list, but just to show you kind of what they look like. Literally, there's a million summer internships. They're paid. You just apply. Now you've missed the deadlines, obviously, for this summer, and this summer is probably totally nuts anyways because of COVID. But some of these will be running, and certainly for those of you that aren't too far along, you could apply next year. But there's tons of them. Now, they aren't all in California. So you got to be willing to leave. And that is the hardest thing I have with UCR students. Y'all do not want to leave. Sometimes for good reasons, family obligations, oftentimes because of weather, which is not a good reason. Unless you have like seasonal affective, in which case then go to Reno, but go somewhere, right? Okay, but there's tons of, so I gave you a bunch of these, like, I don't know why, I just have found these lists. I'm sure there's more. Psych might be able to find more, but some of these colleges, and so like James Madison has a great list. Mahala is really cool for those of you who are clinical. This is in LA. And essentially it's a 12-week full-time fellowship for people interested in working in adult community mental health. So not kids, but adult community mental health. It's going to be a lot of working with homeless populations and other marginalized groups, but there's lots of opportunities. Again, they'll all be on this site. Avita is like a resume, but it's like an academic version. It's longer, it's a little bit more in depth, and it emphasizes research. And that is what you would send with your clinical PhD applications or your counseling PhD applications, or really any PhD application. And it looks a little like this. This is a random example. You can see it does look a little bit different than a resume. It is a little bit longer. I just made this up. This is what I share with my lab. It's just an idea. You can Google this and find your own, but it's a good example of how to write something up. And then the next page would be like any other training, research experience, etc. Now see, because it's for PhD, you see I put research experience before clinical experience. If it were a PsyD, I'd switch those two. So let's see what comes next. Another note about ethics: do not over-exaggerate what you've done on your CV. Remember, you've got letter writers, and what happens, especially in the PhD, we only take 4 or 6 kids. We have time to call the letter writers and ask questions. So very important. Another quick note is screen your own media. I don't have Facebook, I don't have Insta, but my kids do. And whenever I've got a kid that's applying to school, I Google them. And the stuff I have seen is disturbing. People doing like, just, yeah, like not things you would ever want a professor to know about you. So long before you apply, go and privatize whatever, however you do that with Insta or Facebook or whatever you people use, make it not visible to me, because I've seen like, you know, nudity and just like really stuff my kids would be mortified. And they are mortified when I'm like, dude, what is this picture? And we do look. Even though I don't have any of it, when I'm looking for my grad students, I double check that there's nothing too funky. Of course, it's information at my disposal. Why wouldn't I? So just make sure you are honest and careful. Recommendation letters. Oh my God. Let's see what we're doing for time. Oh my God, it's 9 o'clock. Obviously, I know some of you have to hop off. The next 2 topics are money and recommendation letters. So feel free to stay. We are going to finish. Obviously, you need to ask people who know you. What do you do if you don't know those people yet? You take the time to get to know them. I have 2 kids in my lab now, both complete. You know who you are because you're on this call. Both completed their bachelor's, one here, one somewhere else. And they are been in my lab for a while, and they're getting to know me so I can write them bang up letters, because they didn't do that when they were in college because they didn't know this was the route they wanted to go, or for whatever reason. So it's never too late. But you do need people who know you. So, you know, especially for those of you who are younger, try and make these connections. You want them to be writing strong letters. And when you go to them to ask, you say, can you write me a strong letter? Which is totally appropriate. You should really have 2 faculty members. They do not need to be in psychology. It'd be great if one was, but your French teacher can write for you. It's really not necessary that they be a psychologist. So go meet us early on. We're not totally freaky. Well, we are, but in a good way, hopefully. Try and take multiple courses. Obviously do well. I mean, it drives me nuts when kids ask me for a letter of rec and they've gotten a C in my class. Like, what the hell am I supposed to say? I don't know you because it's a class of 100 people. So you really need to make the effort. I have a kid in my clinical psych class now who's, you know, kind of chimed in on office hours pretty regularly. By the time this quarter's over, that kid's on this call too, I'll know that kid well enough that I feel like I can write a strong letter, even though crazily we will never have met because of COVID. So it can be done, but you need to put the effort in. This kid like literally comes and just shoots the breeze a little bit and then heads out. And I'm getting to know that person well. So I'm not, please don't all of you do that. I mean, it started as a genuine interest, right? But I'm just saying it's possible to cultivate a meaningful relationship even now. So you need to cultivate. Okay, how do you ask? Don't sweat it. people are so nervous about asking people. This is our job. We all do it. I write like 50 letters a year, like for 50 different people. It is totally normal. So you all are really nervous. As soon as you walk into our office and you look at all nervous, we're like, oh, here comes the letter of rec ask. So don't sweat it. But be organized. Give us your CV. Tell us, what you've taken with us. Tell us your GRE scores. Give us your statements. Tell us anything that would be helpful for us to know. Give a summary sheet of every school you're applying to and why you're applying. That looks really organized. Then in my statement, I can say, this person's prepared their materials really well. They've thought this all through. This is a testament to their maturity and readiness, blah, blah, blah. But give me the opportunity to say that. Make sure that you talk about your strengths, but also any areas of weakness. Give me frickin' envelopes. It's so annoying when people don't give me the envelopes. And be very organized. Should you contact programs before you apply? For master's level programs, it would be weird. There's almost no reason you would ever need to. You can, but it would be odd. Unless there's like a professor you're super interested in and you want to try and do some research in your MA. But PhDs, you almost always will want to contact a professor of interest. Now, PhD programs do run a little differently. Some are a mentor model where you're brought in to work with a particular faculty member, and some are not. You can tell by reading on the website, because we all will tell you what kind of a program we are. But generally speaking, when you apply to the PhD, you are seeking out one or two professors that have research interests that match your interests. And it is appropriate to write to them in advance a brief email that would say, hey, this is who I am. Thought your work on such and such was really interesting. I'm getting my materials ready for grad school, and I'm really looking forward to applying, and I just wanted to drop a line. I see that you're accepting students, because it says on the professor's website. However, if it does not say, you can say, I'm really interested in your work. I'm writing to ask if you will be taking students for fall 2021. But do not ask that if there's in big red letters on their website, I'm taking students. Then say, I just wanted to drop a line and express my enthusiasm. I look forward to submitting my application for fall 2021. That's fine. Don't expect a letter back, because we get a lot of these. The things that annoy me personally are like, I'm gonna be in the area and I'd love to meet you. I don't have time to meet with every applicant. And so I write back very politely and I just say, I don't speak to or interview with people until I've made my final selections. Because it puts some people at advantage, right? If they get to meet you beforehand, that's not really fair to the people who can't afford to, because they don't have a car, because they can't travel out of state or whatever. So I personally don't recommend offering that. It's absolutely fine to say, if you have any questions, I'd be absolutely happy to chat with you. Otherwise, I look forward to submitting my application. Then a professor, and a young professor might do this because they're hungry for students. They might not get as many applicants. Then a professor can write back and say, sure, if you're ever in the area, I would love to have you come to my lab meeting. But it's a little presumptive to be like, I have lots of questions I'd like to ask you. It's also kind of presumptive to ask us a million questions about like what we're working on and our mentoring style, and like apply or don't. You know what we're working on because you can see what we've published most recently. Be very careful about that too. I get a lot of people writing to me like, I really want to study blank and I haven't published on it since 2004. It's not what I'm doing now. So make sure that you are paying attention and that you do your homework, especially for the PhDs. Oh my God, y'all, this is like crazy. I'm gonna fly, is that okay? I can't even see you, so I'm just gonna assume, because you have the slides, but the GRE is a pain in the ass. I hate this test. It's a measure of nothing. If you get a high score, you're smart and you're probably gonna do okay. If you get a low score, it means absolutely nothing. It's $200 and you can take it as many times as you want, and you get to pick your scores now, which is really annoying unless you're clever. I shouldn't self-define as clever, but at UCR, I ask that you submit your unofficial score report so I can see how many, we all can see how many times you took it. Because of course now, they used to report all the scores, but now students can pick and choose, which means richer students can take it 8 times and pick the highest scores. To keep everybody on a playing field, you have to submit them all when you apply to us, and then we can all see how you did the first time, just like poor kids. Nowadays, we're not going to be taking it at all, so it's even better. I do think you need to invest in a class, whether that's an online class like Magoosh or an in-person class, that's your call, and it will depend on your self-discipline. but it is a good investment to invest in a class, a proper class. One, you know, like a Princeton, a Kaplan, a Magoosh, but not like some random thing. Memorize vocab, memorize, prepare, study 3 or 4 months for this thing. Just regularly, you know, it is beatable, but it takes a lot of work and a lot of dedication. So take it, you know, in August with enough time that you can take it again if you need to before applications are due. We'll talk about due dates in 2 seconds. For PhDs and some PsyDs, the subject test in psychology will be recommended if not required. That test is only offered 3 times a year. And for some of the deadlines, you'll need to have taken it in April. So keep an eye on that test because you do need to take it for some schools, about half. And then that's the testing site. This is what the GRE looks like. It consists of multiple sections, 7, one of which is experimental. It always starts with a 60-minute set of writing, 2 essays, 30 minutes each. Then you'll have a smattering of verbal stuff and quant stuff, and there'll be an extra section in there which is experimental and isn't graded, but you won't know which one it is. Except you can comfort yourself. If you get one that's super hard, you can try and convince yourself that that's the experimental, which is usually the case. Scored on a range of 130 to 170. I already mentioned to you the scores that you are going for various levels of degrees. Apply to a lot of programs, and you want to apply to programs of varying status. Inevitably, how do I know what the status is? There are all sorts of rankings that you can look at, and there's some references to those at the end here. But obviously, you can see based on their admission rates. Some are easier to get into than others. The book will show you average GREs. Everybody knows what the good social work programs are. So you can just ask. Like UCLA is a top program. UC Berkeley is a top program. USC will be a lot easier to get into, but it's going to cost you an arm and a leg. So, you know, there are pros and cons to all of these. 5 to 10 for the MA or PsyD because they have pretty high acceptance rates. 10 to 20, 12 to 18 for the PhD. They are hard to get into. I did not apply to that many. I did not have a ton of choices. I applied to 4 because I never did any. I applied to 1 college, so don't ever do what I did. Undergraduate reputation does not confer graduate reputation, so be careful with that. Some really schools you've never even heard of for undergrad have the best. Illinois Urbana-Champaign is the #1 program in developmental psychology. You would never guess that based on its undergraduate reputation, although it's a perfectly fine school. So make sure you are paying attention. Avoid these quasi-graduate schools, Fielding and, you know, whatever, Branson and I don't know, just be careful. Online is a good indicator, although again, there are some very reputable online programs, not at the doctoral level. And be careful about anything not accredited. Generally speaking, for PhDs and some PsyDs, it'll be in December, and for everything else, it'll be January to March. The very high-notch MSWs will be due in December as well, like UCLA. Interviews happen typically January, February, March. You generally have to pay your own way, so save money. Keep in mind, you can usually get a waiver for the application, which is going to run like $80. But usually if you write, like look around at the grad division, they'll often have, like ours has a little thing that you fill out and say, yeah, I'm poor, and we waive it. But if you cannot find it, then you can ask the departments if they'll waive, and most schools will waive. So that part's good, but the interviews you got to pay for. And if you're invited for an interview, spend the money to go out, give up Coachella or whatever you're going to give up to do it. But there's no doubt that doing a face-to-face interview is going to be more compelling than doing Zoom. They won't take you as seriously unless everybody's doing Zoom. Everything is part of the interview, everything. The person who picks you up, the staff, the people you talk to on the phone about scheduling it. So I have lots of interview advice. Generally, you have to accept by April 15. Interviewing, only say positive stuff. Do not talk smack about your advisor. Do not talk smack about professors. Just be nice. And then you can read this on your own dime and time. But basically, there's going to be questions about you. The main advice here is if they ask you for a weakness, list a weakness. Don't be like, oh, I work too hard. That's not a weakness. That, you know, that's what we want to hear. But really be honest, because we're looking for that. People are anxious that you're from California. You won't want to leave. That's a common question you'll get. et cetera. So these are just some sample questions that you might get about you, about your research, and then you'll be asked to ask questions. Here's some advice for questions you might ask the faculty and questions you might ask students. And keep in mind these do nots. You do not ask about money and authorship and stuff like that until you've got the gig. Same thing about being from an underrepresented group or having a disability. I would hold off on some of the more intensive questions, like is Dr. So-and-so homophobic, until after you've gotten the offer. And then you can follow up and ask questions of students, for example, because you've already got the offer, it's not going to go away. So now you can really be honest. But it is also okay. I mean, I think it's fine to say, you know, what is, especially because there hopefully will be other students from your particular group, to say, you know, what's the climate like for, you know, et cetera. Money. Oh, okay, so money. There are lots of grants and fellowships and scholarships. You can apply for them on your own outside. Sometimes you'll be given them you know, as part of your award. Sorry, RISE has an acronym. It's like Research, Inclusion, Science, Enhancement or something like that. But there are lots of special programs for underrepresented groups. For MSWs, there's something called Title IV-E, where you receive a stipend and a tuition waiver in exchange for your commitment to work for child welfare for 2 years after getting your degree. You have to apply for that, and to win it, you need to have a documented history of working in child welfare or working for child welfare issues. But there are these hidden ways to pay for things. Just do your homework. PsyChi should have good resources on this. I've given you a bunch here as well. You also can get teaching assistantships and research assistantships, even at the MA level. So one of my kids, one of my staff is going to CSUN to do his MA, and they will be offering him teaching payment. So he'll help with the class, and that will help pay his tuition. Of course, there's loans. You'll fill out a FAFSA, but there's not the traditional kind of financial aid that you are getting as an undergrad. Working and going to grad school is variable. Some programs certainly are amenable to that. Typically the MA level programs would have that built in. None of the doctorates are expecting that. And in fact, at UCR, we don't allow it. So, you know, whether or not you can work and go to school is different across programs. Great, we're done. Let me get to questions, but there's just lots more resources for you here. These, again, will all be provided to you. Here's a bunch of great books. Here's some stuff for social work. Here's some stuff for counseling. This, Mitch Prinstein is a professor at UNC Chapel Hill, who is just awesome. A lot of the information I've given you comes from him. These resources are to die for. So read up on his advice. He's the director of their clinical training program. He's awesome. I happen to have known him. He was actually doing his internship at Brown University's hospital when I was an undergraduate there, working in the hospital, volunteering, doing research. So he and I have chased each other around a long time. And more reading, and even though I've probably depressed the hell out of you, don't give up. And let's end with questions. So I'm going to the chat. I'm sorry, I hope this was helpful. Too late in the quarter to apply to PsyChi. Can we contact you individually? Of course. What if you don't pass? Can you take it again? I think this is where we left off. Sorry, when we are applying, when we are applying, how conscious should we be? Shit, I just keep scrolling around. Sorry. Well, there, how conscious should we be about finding a faculty advisor for a program so for PhDs, you need to identify a potential faculty advisor. It's absolutely essential, 1 or 2. Ideally, you will contact them, see if they're taking somebody so that you don't, it's really sad. Like I didn't take students one year and I had told everybody and I got so many applications and they just like left. Thank you for the positive comments. I appreciate it. God's Children I've heard of, and they do hire. It's a residential treatment program. So is Olive Crest. So is Margaret and David and Margaret group homes. There's tons of them kicking around. Safe House is another one. I didn't have a good experience there. That is definitely going to be the case. Group homework is brutal. I did it I did it all the way through college, actually. So I worked night shift, so I could do homework, but yeah, group homework is brutal. Are these options things that we can do as an undergrad? Yes, although some things require you to be 21. But there are other gigs that you can do as an undergrad. Behavioral programs, blah, blah, blah. Is it too late, Sakai? Sorry, I'm trying. Any that we can navigate letters of rec with the current crisis. Okay, yeah, so let's talk a little bit about COVID. It's no different. You would go to your professor's office hours, or you would email a professor that you had previously and say, I'm starting to think ahead to grad school and I wanted to touch base with you about and set up a Zoom. That's so no different at all. Everything can be done digitally. Is it impossible to get in no, it's not impossible to get into a clinical program if you didn't take abnormal psych. Unless they require it, in which case you could contact the professor you're interested in, or just take it at a community college in the summer. It's 5 weeks of your life and it's going to cost you almost nothing. I work closely. Yeah, okay, so letters of rec, it would be ideal if you get the PI to write for you. I know a lot of the labs have their students writing. I would recommend having it co-signed then, have the PI write it. Ideally just have the PI sign it, but have the grad student write it. If your grad student has an MA, that's better. If your grad student's getting their PhD and it will be done before you apply, that's great. But there's no doubt that a professor is who you want writing for you, because even if they are, the grad student's not going to probably be a professor yet. So best option is to ask if the grad student could write it, but the professor would sign it. The letter does usually come from the PI, but it doesn't always. There are PIs who just refuse, in which case then you want to ask if they might co-sign it. So at least there's a PI on it. Okay, thank you. Face-to-face interviews. Zoom meetings, none of us is willing to meet with you face-to-face, no offense, so don't worry about it. Everybody's doing Zoom. All the grad schools switched to Zoom too. Coming from a UC matter at all when applying to a UC for grad school? Nope. It doesn't help, it doesn't hurt. Do I do this every quarter? Hell no, it'd be way too much time. I do it every couple years when I update it. GSOE at UCR, do you know if they are waiving the GRE? I think everybody is getting rid of the GRE at UCR. So I would assume so. And given the complexities of this year, I would really assume so. I'm sorry I was being unclear. I was asking if having a PhD in clinical psych opens up. Yes, definitely a PhD in clinical psych opens up more opportunities than a PhD in counseling. It is the most versatile of the degrees. Not by a ton, but it is, it is definitely most versatile. Yes, it's not bad at all. Of course, everybody has to work. Let me rephrase that. Not everybody has to work, but we all recognize that paid work is going to be crap work when you're an undergrad, and it should absolutely be on your vita, but it'll be other professional experience, because although other than taking into account that you're somebody who had to work all the way through, which is great because that suggests good work ethic, it's not relevant to the gig. So don't absolutely list it, because it shows that you're organized and that you've had stable employment, and it's usually a flag that you're not the richest person on earth. Otherwise, who would be working? So yeah, I didn't mean to in any way say it's bad. It's definitely great. It's just not as great as research, obviously. Okay, if we know we want to pursue clinical PhD or PsyD, yeah, so this is a really good, thank you for asking this question, because the question was, if you know you want to do clinical, but you're not sure about a PhD or PsyD, or you're anxious that you won't get into a PhD, hell, apply to both and see. So much of it's luck when you get to the top caliber there, like you never know. So, I think it's highly unlikely that you're going to get into UC Berkeley. I think it's highly unlikely that the Pope's going to get into UC Berkeley, because they only take 2%. But by all means, apply, because God, what if you did, right? So I think that's perfectly appropriate. Same thing, people get, should I do an MFT or an MSW? Apply to both, get in, see where you get in, talk to students, ask them what their experience has been like, ask them what their careers look like, and then make an even more informed decision than you can make right now. If I didn't get accepted to a PhD program and I have a coordinator position, how can I strengthen my application even more? Publish. So I didn't get it. This is so common. So many people have to apply multiple times. Don't be upset. Medical school, PhDs, like it is not at all unusual to apply more than once. And one of my kids just got into medical school on her second try, and boy, is she glad that she didn't get, you know, too disillusioned by the process and was willing to do it again. If you really want it, keep trying. The thing that typically will set you apart is to publish. So I published a paper in undergrad, and that made all the difference in terms of getting access to these programs. But it's very hard to do in that time frame. This was in neuroscience, which is a little bit faster. So that's a really good thing to do in your gap year, is get conference experience or publish. Do you see schools only offer research-based programs? No, all the universities do. So all the big schools will. Yeah, so we do not know what we're going to do now that we don't have the GRE. GPA will continue to be extremely important. But like how are we going to make these decisions when we don't have this numeric? And actually we have a faculty meeting on Thursday about this very issue, because for so long we've used the stupid GRE as a cutoff. What are we going to use now? And so I can't really answer that, except that of course that will put even more pressure on the GPA. And just because we don't take the GRE doesn't mean you can't take it and submit it optionally as an addendum, because if you did a very good job on it, that would maybe reduce any concerns we might have about a lower GPA. Although I haven't confirmed that because we haven't had our meeting. But that would be something, if I were a student and I had a somewhat low GPA, but I knew I was really smart and talented, I would go and I would take the GRE and get a high score and submit it as a supplemental document and hope that they would see it. Okay, how do you publish? You develop a long relationship with the professor and you work your ass off, and then you pray the data work for you. It doesn't matter so much if you're first author. Obviously that's great, but just to be part of a writing process is great. There is an undergraduate research journal, which I'm glad somebody mentioned. Alexa mentioned it. It's better than nothing, for sure. But it's not a publication it's not going to, you know, a lot of people publish in undergrad research journals, but it's just like going to RPsych is great. It's not WPA, which is great. And WPA is not APA, right? So you do as much as you can and know that you've done your best. Okay, will PIs be particular as the order of, do they only prioritize? No, that's a great question. So no, I mean, obviously if you're first author, that's ideal, but in my lab, undergrads cannot be first author because it's recognized that there's no way I've ever had an undergrad that could write a peer-reviewed paper as first author. They're too young. And even when I did it, I co-authored. So it was my PI was first and I was second. Was going to set up a website and include the undergrad assistants. Would that be helpful? Yeah, so most of us have our undergrad assistants on our website as little, you know, blurbs about them. You know, it's not as important that you have like your own website as it is when you hit the job market after getting a PhD or a PsyD or something, but it doesn't hurt. It's something that when we Google your name, we'll find you, and that's always good. So I don't see any more questions. Are there any more questions? If you're focused on wanting to develop interventions towards a certain issue, I would recommend a PhD for sure over a PsyD, because PsyDs don't do research. But you may look at a counseling or even a school psych degree too, because both of those venues do a lot of intervention work and program evaluation. Yeah, no, whoever's got the paper pubbed in CogNeuro, congrats to you. My first publication was in the Journal of Neuroscience with rats. I ended up going into clinical work with kids. So absolutely not. What it shows is that you have solid writing skills, solid analytic skills. Your professor thought you were well enough, you know, strong enough to write with them. It's not going to hurt you in the least. It can only help. Can I speak on postbacks versus more experience? If you're rich, postbacks are great because you'll get more experience and you'll get, you know, more coursework. But postbacks are very expensive. So that would be the drag. Can I speak more on, actually one of my kids, who is that? Oh yeah, one of my kids that got into a very good PhD program, Columbia in fact, she did her postbac at UCI. So yeah, that's a common thing to do. Okay, thank you for holding the session. Postbacks versus more. You're not wasting your time being a research experience assistant ever, because you are getting really important knowledge that you can communicate to the PsyD about your ability to consume research literature to inform your practice, which PsyDs do want. And of course, you're getting a much better letter of recommendation. Can you practice intervention without a PsyD? Sure, you can practice interventions with a master's, but you need to have a license to practice anything. So that means a master's that's licensable in counseling, MFTE, social work, or a PhD or a PsyD. Some people get a master's but apply for a PhD program for the funding and then drop out. Is this a common thing to do? Do I recommend it? Yeah, so I have heard this too, and so one way to get a free master's is to get yourself into a funded PhD program and then just drop out after 2 years. And that, you know, maybe that happens intentionally, but I don't know anybody who's good enough to get into a fully funded PhD program that doesn't want the damn PhD. However, there are definitely people who realize somewhere along the way that it's not the right fit and they leave. And yes, those people are leaving with a free master's, but remember, it's a master's that they can't do much with, right? It's a research master's. You don't, if you go to a clinical program and you drop out with the MA, you're not going to be license eligible there because it wasn't a terminal MA. It wasn't with a child track, with a MFT track or a counseling track. So it's just not, it's not a common thing to do. Although at least not in psychology. Do I have to reapply to UCR if I want to do my post-bac there? I'm a graduating senior. We do not have a post-bac program in psychology. I mean, I think you can take classes through the extension, but there are formal post-bac programs, like UCI has a formal post-bac program. That's what I mean by a post-bac program. Can you diagnose as a PsyD or PhD? Yes, you can diagnose as anything. But dropping out of a PhD has to look bad. Well, nobody knows you dropped out. You just list the MA and where you got it from. Now, somebody might know if they know that that school doesn't offer an MA, like none of the UCs offer MAs. So they would know, but no, I mean, you just can't do that much with a damn MA. So it's not a great degree. If you're going to get an MA, you're getting it so that you can get to the PhD, or you're getting it so that you can do clinical. Formal post-bac programs are more expensive because they have zero financial aid. So that's the problem with them. I believe that UCLA's graduate program won't let you get the MA because you dropped out of the doctorate program. I don't think that's true because typically all of them allow you to get the MA on your way to the doctorate. So once you've completed the MA thesis and defended it, you've met all criteria to get an MA, but we'd have to ask UCLA. And yeah, I know postbacks suck. They're so expensive. Is there a way to save the chat information? I am sure I would simply highlight it all and save it because the questions are of interest. Is that why? I mean, I don't know why you guys
copy and paste in the chat.
Okay, I'm gonna put all the chat in as an addendum. I'm saving it now. I realized that people want the chat because there's some resources in it. I just realized, I was like, why the hell would you want the chat? It's got no answers, but it does because you guys had some side conversation. Okay, anything else? Awesome. All right, so, oh, wow, thank you, Fernanda, because I had no idea about that. However, I have highlighted it all, so I'll get it that way. Let me stop screen share and just say goodbye to you people. Stop share. Oh, look, there's so many of you still here, you suckers. But about half of you are gone. All right, all good? All right, I'm going to sign off, which means I think you'll all, I think I have it, don't worry. I'll get you the chat, don't worry. Oh, you guys are very nice. You're very welcome. Have a good night. I'm going to go play Animal Crossing and eat my dinner.
Drop your Switch info.
Oh, why? Are you really good and will you give me money? Because I'm trying to become a billionaire.
I know how to finesse and play the stock market. I will help you.
All right. Bye, guys.
Bye.